Alhamdulillahi Rabbil Alameen. Ar-Rahman Ar-Rahim. Maliki Yawmiddin. إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Amen. Welcome to the Master's First Sunday. Thank
Yes,
you, brother.
alhamdulillah. Yeah, thank you, Imam Elam. I think we're right on time with the schedule. I can't see my clock in front of me, but I'm Imam Wathuddin Muhammad, and I'd like to welcome everyone to the Mosque Cares First Sunday Community Program. I hope everyone is doing well and enjoying this good spring weather. And we're going to officially start the Mosquez First Sunday. We have a great program lined up. We have Sister as our keynote speaker and our guest, Sister Ellen Rockman, daughter. If those of you have seen, I opened the email with the guest speakers along with her husband. They're going to be presenting today, and we're going to start out the program today with the Muslim Health Consortium headed up by Dr. Imam Mikhail Ramadan. Yes. Alhamdulillah. I believe this is the first Sunday following our program. I believe. No, we had our first Sunday last week, or last month, pardon me. But we had an excellent Ramadan session, and yeah, I believe that was last month. This may be the first Sunday following the Ramadan session, and we sent out appreciation and thank yous to all of the participants. We're still getting a lot of back responses, post response for the Ramadan session about how well it was received and how inspirational that the speakers were. And I agree. I also am a witness to like a heightened level of spirituality, and much of it is due to this ever-changing climate in the world for religion and for family life and for community life. This is a very important time for us as a community, very important time for us as individuals, to reflect upon those things that are most important in life. Allah tells us to regard, when he speaks about, it brings to mind when he speaks about what regardfulness is and what it should mean to us, that you first should have regards for Allah and his messenger, and for the hellfire, and for the family ties. So these are things that when times become difficult and more and more unpredictable, that these are the things that we should reflect upon, or that we do. Our own nature brings us towards regardfulness towards God and the power that he has over his creatures, us being the crown of of his creation and the most important and thing in the creation of the heavens and the earth. We view ourselves as being more important even than the creation of things that we may find that aren't in our control. But we have to have respect for God, because God told us, he tells us in the Holy Quran, he said, do you think that your matter, speaking to man, is more important or bigger matter, not a bigger matter, more important, a bigger matter than the creation of the heavens and the earth? So we have to be aware and conscious of our role, the role that we play in the bigger scheme, in the greater scheme of God's creation. And so at this time, I'm going to ask if Imam Dr. Mikhail Ramadan is available for opening up our first portion of the program today, inshallah.
Assalamu alaikum. Thank
Wa
you,
alaikum
brother.
assalam. Alhamdulillah, good to see you.
It's good to be here indeed.
Allah.
Bismillahirrahmanirrahim. Ashhadu an la ilaha illallah wahdahu la sharika lahu. Ashhadu anna Muhammadan abduhu rasuluh sallallahu alayhi wasallam. We do like to thank Imam Wahdi Muhammad II, the Mosque Cares, always for this opportunity for the Muslim Health Consortium to come and present to the community those things that we've had a chance to research and look into, and that we feel would benefit us as a whole. So with that, we'd like to get right into our discussion. We have a lot of information that we'd like to cover today, and inshallah, you'll find it interesting and useful. Let me begin. As you know, we generally begin with the public health update, and we always start there, then go down to the community level, and then the individual, family level, and then the individual level. Just to bring you up to date with COVID that we've been reporting on for the last 3 years, it's now sitting in the back burner. It's still present. It looks like it's going to be with us for a long time, perhaps seasonal, but it's not raising the problem for us that it has in the past. We'd like to let you know that measles, that we mentioned before, is on the comeback trail. Measles, we had thought we had knocked it out with our vaccines, the MMR vaccine, but it's coming back, and we want to remind you that it is highly infectious, very infectious, and it affects the lungs and the central nervous system, and especially in the young and the old. Last year, we had 58 cases in all of 2023 in the U.S. So far this year, we have 128 cases just so far. So we're heading for a larger number at this rate. So you can still get your vaccine or a booster, and encourage the young kids, their mothers, and parents to get their vaccinations. Just to touch on it, cholera is on the rise worldwide. And you might have heard something about the mosquitoes, especially in New York and Alabama. It's the Eastern equine encephalitis, just from a mosquito bite. And you've heard that the statements that mosquitoes are the most dangerous animal in the world, the little mosquito, because of what it can carry. Okay. Now we'd like to switch to and we'll be pivoting several times today. We'd like to pivot to something that is on the front burner, and something that very likely will be impacting and affecting all of us. And we give you this warning in the same way that we did back in 2019. Before COVID was just something to mention. And nobody had heard about COVID-19 or coronavirus. And but the same thing now, bird flu is at that point with us. And bird flu is the highly pathogenic avian influenza. Just like us, the birds get the flu also. And it's the technical name for it is H5N1. And it kind of, it's been around for a couple years, and it's been killing worldwide millions and millions and millions of birds. The birds were having a pandemic that we weren't even aware of until in Texas, a veterinarian noticed that the crows and pigeons and other birds were dying and landing on the Texas farms. So she was a veterinarian. The problem arose when the cows were getting sick. A cat died, and the dairy workers were also getting sick. And we discovered that in the birds that had the bird flu, the virus is present in the mucus and the saliva and the feces in infected birds. And when the farm worker got sick, and one worker in Texas was confirmed positive for bird flu, this woke everybody up. And later we got another person in the US who had gotten bird flu. And, the flu was really spread by aquatic birds, wild birds, and it went into the domestic flocks, domestic poultry, and then transferred to the cows, animal species. That was a big moment. And a few weeks later, it was in the dairy cows in Kansas, New Mexico, and Texas, where we were mentioning. And then it starts showing up in the milk and in the eggs. And as the surveillance spread, we find that the virus, the avian flu, is not only present in man, but also in seals, bears, foxes, skunks, minks, cats, dogs, tigers, leopards, and mountain lions, raccoons, and we have found it in one dolphin. How it got there is now how it got there, we are not clear. And just to remind you, since 2022, 58 million birds have died. 58 million birds have died either directly from the flu virus or they were killed in the 48 states. Now, this Dr. Pearson, the veterinarian, very properly and correctly said that we don't know what we don't measure. And basically what that means is if your surveillance is not up to par or out to where the virus is spreading, then you're traveling in the dark. It's just like you're trying to fly a plane in a storm and you're not trusting your instruments. You don't know where you are, how high you are, how fast you're going, or if you're heading in the right direction. And all you're doing is trying to keep the passengers from panicking. That's kind of how things are right now. We know the bird flu is way out ahead of us, but how far, we're not sure. We know that humans can be infected through close contact with infected cattle, birds, and contaminated surfaces. So you probably asking the question, should we eat eggs and chicken and beef or dairy products during the outbreak? Well, the government is sort of assuring us that everything is okay now. What is the basis for that assurance? Well, one test found that 1/5 of the commercial milk samples that were tested was positive for the remnants of bird flu. Now, remnants doesn't necessarily mean infectious particles. They're supposed to been killed through pasteurization. Okay, that is being tested, and that's what we have been and the government is relying on the pasteurization process, making the milk proper and useful for us. Because we have found that it can show up in asymptomatic cows, not just the sick cows, but those that look like good cows, so that they would miss testing if you're just eyeballing the sick looking cows. It can show up in the lungs of asymptomatic cows. That's not good. So our testing has to get more extensive. We have 3 government agencies who are responsible for protecting the public in the US. The CDC, which looks into outbreaks and foodborne illnesses, and the FDA, that's responsible for most food products except meat, poultry, and processed eggs. Okay, all of the other food products the FDA is responsible for. And there's the USDA, and they're responsible, these are the ones, for food safety and inspection services, that the dairies are clean, the chicken coops and poultry farms are up to speed, and all meat, poultries, and egg processing is under them. So testing that occurred last week, 30 samples of ground beef was tested. And on the basis of that, they say, yes, the meat is good. On the basis of 30 samples, meat is in stores throughout the country. Cattle herds are, so 30 samples and making a statement on that basis is pretty narrow. So far, 46 dairy herds in the country are positive in 9 states. So this really, we have to keep an eye on this. And quickly, before we go into the next section, what are the symptoms of bird flu in humans? Well, it's same flu symptom we've seen all along. It's the sore throat, fever, runny nose, cough, shortness of breath, nausea, vomiting, diarrhea, and in the more cases, worst cases, you can go to seizures and pneumonia. But the thing that stands out is conjunctivitis, and that's pink eye. Pink eye can occur in the cows and in human beings, and it doesn't mean that you can't have it without the pink eye. But if you get the pink eye, then that gives the clinician a heads up. Consider this possibility. So, what is the public to do? Be sure you cook your eggs and your steaks. You like rare or just warmed up steaks, let that go. Should be well done. And really, the internal temperature getting up to 135 to 145 degrees in those steaks. And cook your eggs. Not really advising any runny eggs or raw eggs at all. Okay, cook them good. Avoid unpasteurized milk. If you in the habit of going to the farm and getting unpasteurized milk, break that habit. Okay, don't even feed that to the cats or the animals, because it can be transmitted through the unpasteurized milk. And as we said, so far, the FDA is saying that commercially bought eggs, the possibility is low, and the milk is okay because it's pasteurized. And so, you have to think about the butter, the milk, the cheese, the yogurt, the mayonnaise, You know, they're saying everything is okay so far. Now, the problem is that the virus can jump and mutate in all of these hosts. Those pools of viruses are mutating. And if the virus should learn, and we just put learn in parentheses, how to go from or become airborne, then you have all the ingredients for another pandemic. And this is not good because some scientists have said that it could be, because it's in the food chain and the way that it travels and what it's in, could be 100 times worse than COVID. Now imagine that. So we pray Allah that mutation doesn't occur, but alhamdulillah. In the meantime, they are scurrying to prepare a vaccine to do their genomic testing on the virus to see if there's different strains of the avian virus that are around, and preparing the vaccine with the best shot in mind. Um, there's always the same antiviral drugs that we've had before, the Tamiflu and Relenza. They are, I'm sure, being stockpiled. So before we go into our next topic, we just like to say that we are watching this and will, inshallah, be reporting to you as how this is progressing and the extent of this outbreak. Alhamdulillah. We would now like to transfer or pivot to our topic for today, and this is Black maternal and infant health. And this is, we just came out of the month of maternal and infant health. This is a shocking statement that I found, that it's been said that the U.S. is the most dangerous developed country in the world to give birth in. And that statement is even more true for Black women. The most dangerous developed country in the world to give birth in. How can that be? The U.S. has on average, about 20.1 maternal deaths per 100,000 live births. And that's really low for developed countries. In Black women, they're 3 to 4 times more likely to die from pregnancy-related causes compared to white women. 3 to 4 times. What's the cause of that? For Black infants, they're more than twice as likely to die within the first year of life compared to white infants. These are astounding statistics. What is the cause for the disparities? They include systemic racism. What we mean by that? Just racial preferences and racial discrimination. That's very big. Also, the lack of access to quality health care. We don't have the clinics, and sometimes the quality of the clinics is not that good. And that we find that there's implicit bias in healthcare settings. That's right, that everybody isn't treated the same. You go to a doctor that has high credentials, and you're thinking that you're getting the benefit of his credentials and training, and you're not. And you would ask, how can I explain that? It's an implicit bias, conscious or unconscious. Also, there's the social determinants of health, such as poverty and the lack of education. Now, how can these issues be addressed quickly to increase access to prenatal care, expand our medical coverage. Like there's some states who opted out of Medicaid, okay? They just rather, for political reasons, let the people not receive aid that they could get for political reasons. All of the poor people that they have in their states, they declined Obamacare. Also, cultural competency. By that we mean respecting Black culture and Black people among healthcare providers. That's right. Not realizing that you harbor prejudices, and that really impacts your clinical judgment. And we need to ensure that the needs and concerns of Black women are being heard and addressed. Okay? Sometimes people speaking, but it doesn't move or start your mental processes that's a medical complaint that she's talking about. It may be, uh, mixed in with other discussions that you might be hearing, but you have to be sharp enough to recognize a medical complaint when it comes across in front of you. And sometimes cultural infancy causes that. The other topic that we have to talk on when we're addressing these subjects is abortions as a matter concerning Black maternal and infant health. Abortions are in that same spectrum. In the United States, the abortion rate for Black women is almost 5 times that for white women. 5 times as many abortions for Black women as white women. That's that for white women. Okay. In the US, abortion has become politicized, and that's always bad. Public health get politicized, abortion get politicized. Any of these clinical issues become politicized, and that's, in my opinion, become irrationalized. We see that the presidential election, the campaign strategy, is to associate freedom and control of the woman's own bodies with abortion rights. So that's in there. So generally, abortions result from unintended pregnancies. Okay, unintended pregnancies. Some people feel that abortions are promoted among people of color to lower our populations. There's a historical truth to that, okay? But that needs to remain on the table. Now, in the last couple of minutes, what about abortions in Al-Islam? What is our position on abortions? The start of life is believed to occur at the moment of conception when the egg is fertilized by the sperm. Now, this was expressed to me in a personal discussion that I had with Imam Muhammad. These discussions were documented in the blue pamphlet on abortion from the Office of Healthcare and Planning in 1976 and 1977. Those pamphlets were distributed publicly. I was looking for the one that I have, or I couldn't find it, or show it to you. Abortion is permissible in Al-Islam when the life of the mother is at risk. In cases where the mother's life is not in danger, abortion is not permitted for simple desirability, convenience, or economic considerations. Those aren't strong enough or appropriate for an abortion. But opinions vary among the four major schools of thought in Islam: the Hanafi, Maliki, Shafi, and Hanbali. Generally, they hold the view that abortion is not permissible after the fetus has reached a certain stage of development, known as ensoulment. That means the soul has gone into the fetus. Ensoulment refers to the moment when Allah breathes the soul into the body of a developing fetus. And that's from the Quran and Hadith. And their argument is that up until that moment, the fetus is developing just like any other mammalian creature. And in fact, is very similar. But at the moment that Allah breathes the soul into that fetus, then that takes on the character of the human being. That's what those other schools. Some scholars view that ensoulment occurs between 80 to 100 days after conception. The exact stage varies among schools. Some schools allow abortion only in cases where the mother's life is at risk, while others may also permit it in cases of severe fetal deformity or harm to the mother's health. However, the general consensus is that abortion is discouraged except in specific circumstances and should be avoided whenever possible. Last quick subject before we pivot again. The matter of choice in Al-Islam. You know, you hear choice echoed all the time, pro-choice and anti-abortion and whatnot. But where are we with choice? Concerning law and public pluralistic society. Almighty God Allah respects the intellect that he granted to man, even the choice to worship him or not. There is no compulsion in religion. The means in a pluralistic society, that means in a pluralistic society that we have to acknowledge rights of other faiths, including the preferences of non-believers. So our job is to convince them with our dawah and our invitation to Al-Islam to celebrate wholesome family life, to celebrate pregnancies as a blessing, and to avoid abortions. That's it. I'm going to turn this now into the hands of Sister Sharon, who will take us deeper in some of the areas that I touched on. Thank you. Assalamu alaikum. Sister Sharon.
Wa alaikum assalam, Dr. Ramadan, alhamdulillah, and Imam W.D. Muhammad, President of Mosque Cares, Brother Imam Elam for the technical help, and the audience, the Mosque Care audience, assalamu alaikum. This is a serious topic, and as a female and a mother of 3 adult children and watching grandchildren, it's a beautiful time, actually, to talk about this specific topic and how it affects us. We're at the center sometimes of the family. So inshallah, we're going to share with you a brief presentation on just how important motherhood is. And inshallah, as you realize, next Sunday is Mother's Day for those of you out there. So inshallah, many of you mothers will be attending weddings of your children or going to colleges, graduations of your grandchildren or your children. So this actually is a beautiful time of a year, but we want to stay on this topic of how important it is that we improve the health of our mothers and our infants, inshallah. So I'm going to share the screen, inshallah. All right, alhamdulillah. All right, so that's our topic, Black maternal and infant health. As a respiratory therapist, I've been witness to, depending on what facility you work in, just the types of health disparities that our Black mothers and our infants experience historically. So this is a very important topic, not for us, but our communities, those that we interact with, our families that aren't, following the Islamic faith, but we care about them and we want to empower them to have their very best health outcomes, inshallah. So, a saying, alhamdulillah, there was a saying to Prophet Muhammad, peace and blessings be upon him. Let me see if I can. O messenger of Allah, move this out the way. Okay. Who is the person that has the greatest right on me with regards to kindness and attention? He replied, your mother. And then who? He replied, again, your mother. And then who? He again replied, your mother. But the last time, then who? He replied, your father. Okay. And also, someone asked the messenger of Allah, I want to join the fighting in the path of Allah, and I have come to seek your advice. He said, then remain in your mother's service, because paradise is under her feet. Alhamdulillah. So for those of you who are on, have the ability to see on Zoom or Facebook, found this beautiful picture of this mother. There's nothing like a mother's love. And she's holding her infant. Looks like a newborn for the first time. It's an African-American mother. So just wanted to share that with you. All right, so let's talk about Black maternal health disparities. Ready, inshallah. All right, so Black women are 3 to 4 times more likely to die from a pregnancy-related cause more than white women. Multiple factors contribute to these disparities. Dr. Ramadan alluded to them, such as how the quality of healthcare varies, what type of underlying chronic conditions they have. Of course, we talked about structural racism and implicit bias. And this is from the CDC Office of Healthcare Equity. Okay, so how does racism and inequality and discrimination lead to disparities in our African-American mothers? So the leading causes of maternal death and complications in the US, they're treatable conditions. And they include heart disease, high blood pressure, the mother becoming infected, some embolisms or blood clots and hemorrhages. And that comes from the University of Chicago Medicine. Okay, again, most pregnancy-related deaths are preventable. So according to the Office of Health Equity, each year in the United States, hundreds of people die during pregnancy or in the year after. And thousands have unexpected outcomes of labor and delivery with serious short and long-term health consequences. So every pregnancy-related death is tragic, especially because more than 80% of pregnancy-related deaths, as Dr. Ramadan spoke about earlier, they are preventable. And again, this is from CDC. All right, so what's infant mortality? Why do our infants leave here? According to the CDC, it's the death of an infant before his or her first birthday. And so infant mortality, the rate is the number of infant deaths for every 1,000 live births. In addition to giving us key information about maternal and infant health, the infant mortality rate is an important marker of overall health of our society. All right, so let's talk about some more leading causes: low birth weights, congenital malformations. You've heard of SIDS, sudden infant death syndrome, accidents, unintentional injuries, and maternal complications. So how does infant mortality affect us, the African-American population? So non-Hispanic Blacks and African-Americans have 2.5, 2.4 times the infant mortality rate as non-Hispanic whites. Non-Hispanic Blacks or African-American infants are almost 4 times as likely to die from complications related to low birth weight as compared to non-Hispanic white infants. And non-Hispanic Black or African-American infants had 2.9 times the mortality rate of sudden infant death syndrome as non-Hispanic whites. And this was from 2020. And in 2020, non-Hispanic Black or African-American mothers were twice as likely to receive late or no prenatal care at all as compared to non-Hispanic white mothers. Okay, we move on. According to the Office of Minority Health, non-Hispanic Black or African Americans have 2.4 times the infant mortality rate as non-Hispanic Blacks. Non-Hispanic Black African American infants are almost 4 times. Inshallah, we'll move forward. That looks like a repeat. All right, so how do we begin to reduce some of these health disparities? Well, number one, let's talk to the healthcare provider. And if anything doesn't feel right, we have to be advocates for ourselves. Or if we're in the room and we're a family member, we have to be advocates for that pregnant female or mom to be. We need to know and seek immediate care if we're experiencing any of the urgent maternal warning signs, such as a severe headache, extreme swelling of the hands or face, trouble breathing, heavy vaginal bleeding or discharge, overwhelming tiredness, and more. These symptoms could indicate a potentially life-threatening complication. So, again, we need to share our recent pregnancy history during each medical care visit for up to 1 year after delivery. We need to connect with our healthcare and social support systems. They are there. And we do this before, during, and after our pregnancies. Okay, and healthcare providers, what do we need to do? Ask questions to better understand their patients and things that may be affecting their lives. We know the healthcare system is short, on clinicians, but take the time. This is your calling to address the patient's needs when they present to you. Help your patients and those that accompany them to understand the urgent maternal warning signs and when to seek medical attention right away. Help the patients manage chronic conditions. So if you are the one that's taking care of the pregnancy, the physician taking care of the pregnancy, well, there's referrals for other chronic conditions that may be present at the time. And so make sure that all of that's working so that we can have a healthy pregnancy. Such as hypertension and diabetes and depression. This is Mental Health Month we're coming up on, inshallah. Also, recognize and work to eliminate unconscious bias, as Dr. Ramadan mentioned, does exist. We live a certain way, we grow up a certain way, and try not to bring it to the office. Respond again to the concerns of the patients and provide the patients with respectful and quality care. All right, what can hospitals and healthcare systems do? We need to identify and address, again, that unconscious bias. And usually HR does have courses, for those who work in the various facilities to address those issues. Standardize and coordinate the care. Everyone should be receiving quality care. And how do you respond to emergencies? Improve delivery of quality prenatal and postnatal care before the pregnancy and after the delivery. Train non-obstetric care providers to ask about the pregnancy history in the prior year. So listening, if you cannot see, there's a picture of a clinician listening intently, looking at the patient. All right. Next slide. All right, so now you have a village concept. What can a family do and friends that are close? All right, prenatal appointments. If it's the mother, your young mother, hopefully there's a mother, there's friends around. Okay, you have a doctor to take care of your pregnancy. Are you making your appointments? How about your nutritious diet? Are you eating correctly? Are you laying off the sugar and the salt and the fats? Are you not partaking of alcohol and smoking and drugs? Are you managing your stress? Are you getting adequate sleep? Are you avoiding infections and other environmental pollutants? Do you know your current health numbers? And have you talked to your families, your village? What did mom have? What did auntie have? What did my sisters have? You know, what type of health issues? And become aware of those types of, that type of information. All right. So sometimes you may need genetic screening or counseling. When are those times? So before and during pregnancy, you want to get genetic testing if you have something in the family that you're aware of and counseling. Gene mutations cause thousands of diseases, health conditions, and birth defects, including cystic fibrosis, Down syndrome,
You and your man is the
inherited heart
scumbag.
diseases,
You and your man is the two scumbags in Concourse Village.
hemophilia, and sickle cell disease. Some genetic mutations are passed down through families, as we are aware of. Okay, and just if, for those who can see, we did have Black Maternal Health Week last month. And so we want to, this slogan is saying, we want to ensure that our moms thrive from the bump, the baby bump, to beyond. And so let's talk about the stages of human development. Dr. Ramadan alluded to basically when human life begins and starts to develop. All right, so this is from Surah 23, Al-Mu'minun, or the believer, ayahs 13 through 15. Verily, we created man from an extract of clay. Then we placed him as a drop of sperm in a safe depository. And then we fashioned the sperm into a clot. And then we fashioned the clot into a shapeless lump. And then we fashioned bones out of the shapeless lump. And then we clothed the bones with flesh. And then we developed it into another creation. So blessed be Allah, the best of creators. Alhamdulillah. All right, so when a live birth is not possible, and Dr. Ramadan also alluded to actually when is abortion permitted, talking about the various schools of thoughts from Islamic scholars, some Islamic scholars determining the human ensoulment occurring 120 days into the pregnancy or just over 17 weeks. You have some of the literature, and it's at the back of the slide if you want to review from Islamic literature, that the mother doesn't have physical or mental capacity to carry the pregnancy to term, that the mother has informed her doctor that her life is endangered due to the pregnancy, and that's been confirmed, that both the father and the mother have to have a consensus that it is required, and that there's a severe fetal deformity, and they have listed in some of the literature. I invite you to read some of the literature in cases of rape or incest. So, inshallah. All right. And so just to make you aware, National Women's Health Week is coming up on May the 12th through the 18th of this month. All right. Alhamdulillah. Okay, and there are your various perspectives, the various articles that are out there regarding the issues of abortion. And alhamdulillah. I'm going to stop the share, inshallah. All right. Now, I believe Dr. Ramadan and I have a skit which he has produced just to bring this topic home. It's a 5-minute skit, and it's entitled, I Missed My Period. I'm pregnant, and should I get an abortion? So I'm going to tell you a little bit about Miss Brittany. Brittany is a 19-year-old high school graduate, and she's been going with Roger for over 2 years. She missed her period last month, and her home pregnancy test was positive. She has not told Roger, the father, yet. She is trying to sort out her thoughts and feelings about pregnancy and having a baby. They never considered marriage or anything serious for that matter. They live from day to day as boyfriend and girlfriend. Their plans extended no further than weekend to weekend. Brittany, however, does love children. She enjoys the time she spends with her nieces and nephews, but she has never thought about having children of her own. Just a little bit about Roger. Roger is Brittany's
Roger.
boyfriend. Oh, okay. You good, Dr. Ramadan? Okay.
Yeah. Roger is Brittany's boyfriend, is a 21-year-old young man who works hard at 2 minimum wage jobs. He was a high school football player, but he had no ambition to go on to college or technical school. He is proud of and loves his girlfriend, Brittany.
Okay, and she'll I'll be Patsy. Patsy's a 17-year-old high school senior, and she happens to be Brittany's homegirl and her best friend for years. I'm also a grandma, and grandma is a proud 60-year-old lifelong church member who serves on the usher board and sings in the choir. She always invites her family to church with her, and even though they refuse, she never tires of asking or praying for them. All right. Very good. All right. So here's Brittany. Girl, where are you now? Are you sitting down? I got something to tell you. I missed my period last month and my pregnancy test was positive. I'm pregnant. And I'm Patsy again. What? Have you told Roger yet? Brittany. No, I haven't told anybody but you so far. Patsy. What are you going to do? Come over to my house now. We have to talk. So they're over at Patsy's house. Wow, this is for real. I know some girls at school who got abortions and didn't tell their boyfriends until afterwards. And some other girls who made their baby's daddy pay for their abortion. You weren't thinking about keeping the baby, were you? Brittany, I don't know, but I feel that it's only right and fair that I should tell Roger and my whole family. I'll go and tell them now. So they're meeting at Grandma's house. All right, Roger.
Wow, I didn't expect this. Imagine me, a father. What are you thinking, Brittany?
Brittany, of all my girlfriends are telling me to go get an abortion. They are saying that this was an accident, that it could change the direction of our lives. They were saying that we don't even know how strong we are as a couple, let alone as parents. Will we stay single or think about getting married? What about child support? Will we still live with our parents? You don't even make enough income to support all of us. What kind of future will we have? I do love Roger. I do love you, Roger. Okay. Next, last. Oh, it's his grandma. So you both know how I feel. God doesn't favor abortion. That baby is an innocent human life that doesn't know the circumstances of you both before its birth. He or she could become a great individual who changes the world for the better. You two have a lot of planning, soul searching, and praying to do. This event could be one of the greatest blessings in your lives, bringing you to God and strength individually and as a couple. Or it could be a moment of shame and regret that weighs heavily on you, on the both of you for the rest of your lives. You have to decide if you will rise with God's help to a great future. Ask God to grow you in love and maturity. Your work is cut out for you, but it's nothing you can't do. The best start is to decide that abortion is not a choice for this baby. Your family is here to help and support you and to pray for you. May God bless you. The end. Everybody pray for them. Alhamdulillah.
And thank you, Sister Sharon. That was read very well. At this time, Imam Adil, we can open for questions on any of the topics that we've discussed. Alhamdulillah.
Yes, sir. Thank you, Imam Ramadan and Sister Sharon. You said you ready for questions, Imam Ramadan?
Yes. Mhm.
Okay, those of you who have questions in the Zoom audience, please raise your hand so we can acknowledge your questions. Those of you who have questions on the YouTube audience, please enter them in the chat and we'll ask the questions for you. And those of you on the phone lines, open up your mics and I will acknowledge you that way. We'll start with Sister Tawhida, then we'll go with Brother Anthony. Sister Tawhida.
Assalamu alaikum.
Alaikum assalam.
Walaikum assalam.
Yeah, I just want to, I like the sister bringing up things that, you know, women can have, females can have with, you know, their pregnancies, before their pregnancies. And I just like to bring out the part about what women wear now. And the lot of the leggings, I know when I was coming up, you know, we had leggings like when we did ballet, you know, but I see now that's one of the top garments now in the world, in our areas in the United States. And I like to say that I was told when I was young, be careful of wearing it because of the fabric that it's made out of and the tightness of it around your vaginal area, that it would cause a discharge that you wouldn't even get if you didn't wear that. And I'm saying now, I'm asking, is that the same deal with wearing those tight leggings made out of polyester or nylon or what, you know, whatever it is, since it's so tight, will it still cause the vaginal discharges that you wouldn't have, which, you know, like it's abnormal to have these discharges that is caused by wearing these type of garments. Is it still that way?
But
Dr. Ramadan and whoever could, the sister.
I was waiting on Sister Sharon.
well, what I would say as a female and sister, and actually, I'm not an obstetrician. You know, I'm not a physician who's taking care of prenatal mothers. I am a mother and a grandmother, a mother of older daughters who have been pregnant, and I haven't heard any literature pro or con about, you know, wearing those leggings today during pregnancy, my dear sister.
I mean, even before pregnancy or during pregnancy. And I would think that it would probably not be out as much as it was back in the day for me, and because of trying to sell that garment. I mean, it's real popular. When I was coming up, they didn't have the sizes that they have now. They have sizes now, no matter what size you are, you can purchase one for yourself. So I'm just saying, I would say that they wouldn't have much on that unless it was someone like yourself or Dr. Ramadan or someone else who cared about people, you know, and about their health. So I'm just saying it's the same fabric of the polyester like back in the day, and it's tight, and it just causes vaginal discharges that are like not normal for you to have. It would cause like yeast infections and something else. But you know, if you hadn't heard that, I'll just wanted to bring that out.
I would like to say, Sister, I understand what you're saying, and for many years, that was the general thought. I remember when I was in training and back in the nation, you know, I have many problems with those garments that are so tight like that, you know. But in terms of medically, is there anything that I'm aware of in the literature that says that these tight garments are not advisable for because they do lead to infections and discharges and all? I couldn't say that I'm aware of that, but I do have so many objections to those type of garments, and you know that you know, they don't permit air. I know when anything is in a moist, darkened area, even those parts in our body, you know, they do grow bacteria and fungi and all. If you have body folds, under the folds, there are fungus that grow and bacteria, and in our armpits and other places. And so any tight garments that don't allow air or anything like that, it would just stand to reason that it would promote that. But
Thank you.
but I don't have any information.
Yeah,
Okay.
yeah, but that's how it was back in the day, and I verified that yes, that is true. And I don't think that nobody would do much research to stop the income of
Get it?
how
And people-
it's a lot of that out there. So, well, thank you for your
Yes.
comment. Assalamu alaikum.
Walaikum assalam. Next.
All right, next was Brother Anthony.
Assalamu alaikum, Dr. Ramadan, Sister.
Assalam.
Thank you very much. I'm always up on listening to your report and everything. But there's one that it's come up here just a few bit about empty shelves, and with the bird flu and the swine flu and these things that are attacking our agriculture and the vegetable area, plant them. There's other things that are coming out that I think the other day you made a comment about a lot of the stuff has been out there ahead of us, and some of we have not identified. But going back to the empty shelves, is there something in the air out there that they're talking about because of having to kill off a lot of the livestock because of the flu and how and then going from birds to humans, is this, have you heard any more or have any indication of the effects not that far down the road maybe happening now? Assalamu alaikum.
Walaikum assalam. I didn't quite understand what you mean by empty shelves.
Empty shelves, yeah. Being able to provide the food and you go in our stores, we have plenty of selections, but like anytime we have a storm or something, the stores become empty real quick, and folks are going without because we can't supply. Instead of a storm, this is because of the diseases that are running rampant.
You are right. That sort of heads up and warning was implicit in our discussion. It's saying that the outbreak is spreading, and that any day we could get some bad news that our food supply is not good, that herds might have to be killed, and that who don't eat the meat or don't eat the eggs or don't eat the dairy products or whatever. And that would not be good. There would be a rush on the stores, and the shelves could be empty. This is why we one of the reasons why we're discussing this and giving everybody a heads up, because as you say, that can happen. That can happen. Just this past week at Walmart, they pulled all the ground beef because of an infection of E. coli. Okay, so these sort of things can happen. All right, and we have to be aware. And they will tell you to discard all the certain food products with certain numbers on them, or if they've been purchased in the last 2 weeks, to do that. Yes. So we had practice with COVID, and don't forget your COVID skills, and don't forget your food storage and preparation skills. That's what we're saying. Thank you for bringing that up.
Assalamu alaikum. Thank you, brother.
Assalam. Ma'am, Adil?
It looks like Sister
Our
Maddie.
next question.
The next one was Sister Maddie. Sister Maddie Captain.
Assalamu alaikum.
Assalam, Sister Maddie.
Yes, I just wanted to address that sister that was talking about the leggings. Um, if you buy good yoga pants, you won't have that problem. And if you wear cotton underwear, you won't have a problem. And if you have a lot of vaginal discharge, you need to see your oncologist. I've been see uh your gynecologist anyway, because that's not natural as after a certain age, because the Barton glands is not secreting that much. So if you're having a lot of problems there, maybe you should just get you some panty liners that go into your panties, and that will stop that problem. But if you got a yeast infection, that need to be attended to, because they can give you some neomycin or something, not neomycin, but something for yeast that could eradicate that, because yeast is you're just not supposed to have that. That's candida. And you're not just supposed to have a yeast in your vaginal area. If you got a good, clean vaginal area, the pH balance is supposed to be normal. And no underwear, no clothing that's on the outside of your vagina should be touching your vagina in the first place. That's when you don't have on underpants. And also, Sister Sharon, you had was talking about the blood pressure. You forgot to say about preeclampsia, which
Yes.
is the sisters will have legs. You have to watch your legs and feet also, sisters, because that's where preeclampsia most shows up, is in the swelling of the legs and feet. Um, just want to say hello to my peers and wish them assalamu alaikum. And I enjoyed their presentation. Assalamu
Well,
alaikum.
Thank you,
Walaikum
Sister
assalam.
Maddie. Walaikum assalam. Appreciate
Thank
you.
you, Sister Maddie. We want to tell everybody Sister Maddie is
Good
an
point.
active member of the Muslim Health Consortium, and one of the definite team players on the Lifeline presentation that we make each first Saturday in the month. Thank you for that comment, Sister Maddie.
Assalamu alaikum.
Walaikum
Walaikum assalam.
assalam.
Next question was from number 783. Number 783, 116. Number 783, 116. All right, go ahead. We'll go back with Sister Chahida. Or the person who, if you have your hand up, go ahead and ask your question. Your name is not on your device, so go ahead and ask a question if you have your hand up.
Oh, this is Salim Manan from Saginaw.
Okay, yes, sir. Go ahead, brother.
Yeah, assalamu alaikum, brother Imam, Muhammad II, and brother Imam Adil, and to the rest of the people out there. And thank you for this focus. And I'm compelled to say this. I want to listen, but I'm really compelled because I worked in the health field for over almost 40 years. And I work with a clinic that provide health care for no insured and no underinsured people. And I've seen this. I've worked with this thing for many, many years. The first thing that I will point out is that we had a agency in Bay City, which is majority white. They had a midwife program there, and we didn't have a midwife program in Saginaw. And we found out that that midwife program, whether that mother was had out of wedlock or whether she was married, she went to that group of women that provided health care for that mother immediately. But we didn't have that kind of service. Now, that midwife program I know started with African Americans, but we have abandoned it. But now, this year, we got funding for what's called a doula program. We don't have to go into detail what that is right now, but the doula program is majority women. As soon as they find out a mother is pregnant, they work with them. It's called doula, and I'm convinced that it comes from Abdullah, and they just cut it off and called it doula. And so that program is just starting up. But I addressed this with them. I said that we put a lot of focus on the sisters, and we sometimes demonize them when we have the infant mortality. But we have to take in consideration what's happening to the men. If they smoke marijuana, if they drink alcohol, if they involved in things that aren't healthy and they inseminate, they are also a problem. And we're not addressing that to the degree that I should think we should. we should have somewhere in there where we talk about the men, because once they impregnate the woman, maybe they were smoking marijuana, they already are impacting that baby's health. And they need to understand that and need to focus on that. Another thing that I point out, I think is important, is that now, if you look at the data, not just is because of what I'm experiencing personally, you see that a lot of Caucasian people are experiencing these harmful effects now because of opioids and methamphetamine and all that other stuff. But the data is not catching up with them the way they continue to give it to us. But you'll find out that their infant mortality rate, deformity, and all those other things are climbing at a high rate. And they need to, they need to focus on it. So those are the things that I point out that we need to focus on. That man and in your care. But again, let me thank Dr. Ramadan and the Health Consortium for your report. This is very important, and we do need to focus on it, and focus on also drugs and the harmful effect that it has on the next generation. And thank you again. Assalamu alaikum.
Walaikum assalam. I would like to say thank you, brother, for those excellent comments. Many of the things that we discussed, the social determinants of health care, apply also to white as they get poorer and less educated and are more susceptible to drugs and whatnot, and single parent families, they are impacted as well. They may not have the racism that is added on top of that with us. But, we have seen that when women attend women, okay, especially culturally sensitive women who are motivated, outcomes are improved. And like that midwife program, yes, those are excellent. And many times they are far more beneficial than a detached, highly qualified, educated, credentialed doctor who has no knowledge of the person and who is not interested in what he's doing or has only a few minutes. The midwives who are attentive will do better, and over time will have a better outcome. So your experience is very valid. I can attest to that. Thank you for your comments.
Yeah. And also, if I may add, brother, I have a nephew and his wife, both college educated. They elected to have their baby at home. They paid for the doula to come in, had that baby in the tub. The babies are fantastically healthy. It was an excellent experience. So you're right. It's the ability, first that education, and you have more resources and choices. Alhamdulillah.
Yeah, I had a little different question I was going to ask. You know how you have all these, we've been on all these platforms, and when my wife passed, I had to pay more attention to, they pop up on my phone and the ministry, and a lot of times we try to manage all these different social things, but every now and then you get these little pop-up little ads or commercials or whatever, where a person is telling you as a trying to entice you into trying to and experience a product. And so a lot of times when I see them saying, well, you put this oil with that oil, if you eat this combination of foods with that foods, I take that with a grain of salt. I really don't follow it, because I figure they're probably trying to just sell you a product or something. But when they talk about things that we're very familiar with, like oregano, I heard, and the other day I heard that, but I don't know how true it is, because I said, well, I had a friend introduce me to oregano some time ago as a tea. So they say this oregano tea has more antioxidants than garlic and blah, 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 and it's this and that, or it's better for you than, he named a bunch of stuff. And so I would like to, hear your opinion, and I pretty much would guess that that it's that you probably would advise us to not be trying to self-medicate or try to self-diagnose issues and then try to feed it without I'm a strong proponent of asking a professional, meaning your primary doctor, any questions about any type of thing like that. But how much should we be on guard about experimenting with even things natural like, garlic, onions, and like he said, oregano. The one guy said drink oregano tea. Where do we know where something can actually be a danger, or if it's something that we should look into? Yeah. A lot I said, but it's yeah.
No, I
Mhm.
think that question is spot on. And
Okay.
I see those same ads and pop-up commercials
Mhm.
all along.
Yeah.
And they are really deceptive.
Yeah.
They know how to give you half truths,
Mm.
how to give how to sell, all
Hmm.
right? And
That's how I feel. Mhm.
they know that people want the easy way and want
Right.
to avoid the medical or healthcare system.
Right. Right.
If they think it's a natural or organic, that
Right.
makes it
Then it's
preferable.
okay. It's right.
And so all of these things, there's salesmen, there's half truths, and
Mhm.
there's slick advertising in it.
Yeah.
And there's you have to beware. You
Right.
really have to be aware. I
Right.
listen to some of those things that are more medical that
Mhm.
I have a definite knowledge about. But
Mhm.
the way they sold it
Mhm.
is like, wow, is that right?
Yeah.
And
It's a
they're
miracle
like
pill.
there's
Yeah.
scientific evidence from Harvard and from
Yeah.
these big institutions.
Yeah.
And I said, look at this. Why isn't this in the scientific journals? Why isn't this in hospitals? And
Mhm.
you have to protect yourself now from all of this that's out there. Half truths are very
Yeah.
powerful. Slick salesmanship is very effective.
Yeah.
And, they know how people want to go and they'll just help pushing you in that way. So
Yeah.
you have to be aware of that. If it sounds too good, it probably
Right. Right.
is.
I was presented with a situation that I had to manage because my son was coming to me asking me for something, and we had it right here in the house. Might have been turmeric or trying to get some kind of pills or something. He's in high school and want to be like the kids, the athletes, and they, think if I take this pill, it was a couple of pills. I don't, but whatever it was, I kind of deterred. Oh, he wanted me to get him some sea moss, and then I showed him. I said, I got sea moss in the cabinet. You don't have to buy those pills. I said everything that he had, he wanted some uh, black seeds. And I said, I got some black seeds and black seed oil. I said, always. So I took the opportunity to let him know. Always ask me. I said, I've been on earth 56 years, and most of the things you're going to experience, I experienced it probably 100 times because I got cousins, nieces, nephews. Not alone that I've been 15, and I got aunties, I got nieces, nephews, sisters, brothers, cousins, and people in the community. I all watched them go through the age of 15. So I'm an expert. So ask me before you go out and take a pill, or even if your friends are taking them, ask me first. And so I kind of nipped that in the bud. And so he doesn't look for things to think that you gotta get out there and exercise. You gotta eat healthy, get rest, and exercise. And he's been taking that advice. And
That's
stop
good.
eating when you get full. That's my number one advice. And he's been listening, so I'm really, really proud of him.
That
Because
is
we don't like to stop eating if
good
it's
advice.
good. Yeah, alhamdulillah. Yeah,
Excellent
so
advice.
things it can be scary, like the mosquito and all of that. Mosquitoes love me. There could
Mhm.
be no mosquitoes for 50 yards. Let me go outside on a warm day, it's gonna find me. That mosquito is, I don't know how they find me. So that's probably something that is kind of scary. But our immune system, if I stay healthy and I get rest, I eat right, exercise, that increases lessens the possibility that I may get sick, even what if I get bitten by an infected mosquito? Is my immune system going to help me with that, or?
Absolutely.
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 Okay. Thank you.
Your immune system is your first line. Okay.
Okay.
It will respond instantly and get better over time.
Yeah.
It's got your first responders and you got your late responders, and it can bring your whole system and your energy to the battle. So yes, and what you explained was right. You
Mhm.
know, they will when you mentioned the turmeric,
Yeah,
remember seeing the guy on the skateboard, and there's so many implications in that, like you take turmeric and you won't get
and
injured.
you
You
get
take
your
turmeric
fat
and
changes from white fat, which is dangerous, to brown fat, which is healthy and builds muscle. I said, wait a minute, I can eat turmeric and get some muscle. I don't have to go lift weights.
all of these
A little bit won't hurt, I guess.
yeah, yeah, that's right. It's good. Turmeric is good. I take it.
Yeah,
Okay.
yeah. So I have some. I just haven't taken that bottle every now and then. I take one,
Yeah,
but they say keep it in the refrigerator because it deteriorates. The ones that I have,
yeah.
and then fresh turmeric. I love fresh turmeric. In certain, when I cook, yeah, certain dishes that turmeric. It'll enhance the flavor and give it color. Yeah. So
Excellent, excellent. But
mm,
don't be deceived as to what it will do and what it can do and what it does
yeah,
do.
it's not a
Those
miracle.
yeah, the salesmanship is involved in that.
Yeah.
Truth and then salesmanship, okay?
Yeah, I
And then
couldn't listen
money
long enough to get to the point where I know he was going to sell me some pills. I knew it.
yeah.
I got a
Yeah.
low attention span and ADHD or whatever.
Mhm.
So that saved me.
All
But I'm one of those people that wanna, find that little thing that something nobody else has, or something that's
right.
gonna do something that give you the edge or that other people don't have. I'm not bad, but they get my attention sometimes. Yeah.
Yeah,
And our children too, they get their attention. They
that's
listen, they present themselves as experts, so they don't want to listen to us today. They listen. That's why I tell people we live in a culture today where the culture, the commercial world is playing puppet master with us. They're puppet ma
right.
they're puppet mastering us, and we almost don't listen to anything that doesn't come out of certain those avenues. And yeah, it's dangerous. This is something I joke with people. I say that we don't buy products. We buy images of products. Because when I see those burger commercials, I go get the burger. I'll be like, what is this? This ain't what I saw in that commercial. It's a little bitty, funny looking burger. It's not all juicy and all the lettuce and tomatoes and pickles and all the stuff I like. It's just this little thing, and it don't taste as good as it in my mind it would have tasted. So yeah, we don't buy. And what I love is that when you go in a grocery store and you see the cooler, here's the cooler with the frozen food. You can go in there and grab it, look at it, feel it, hold it, but there's a picture of it on the outside of the freezer. And the picture looks really good. It looks fresh and delicious. All the pizzas got pictures, so stuff like that. So we
Yeah.
don't buy the actual thing. It has to look better than. So when I come home and cook, it looks good the day I put it on the plate, but let me put it in the refrigerator. The kids don't see it. It don't exist. So if I don't put it back on the
Yeah.
plate and heat it up and say, see, it doesn't taste just like it did yesterday, they're not gonna eat it. Yeah. It's something. It's a world we live in, and it doesn't support us having economically having a healthy, well managed economics. We waste way too much. My father used to make a big point of that in the 80s, back in the even 80s, 90s, how much we waste as a people, and I don't blame us. I blame this the culture of that we come from, that we're subject to. We don't come. That's not really our culture. That's the commercial world and corporate capitalism. They're trying to keep us in a position where we're not controlling our finances. That we're following the command of the society. That's why things go out of style so fast. If you don't have
That's
this new
right.
thing, you out of touch. So you got to get rid of all your other stuff and buy all new stuff. And that's the biggest crime. Yeah. To me, for poor
Yes,
people. Yeah. So alhamdulillah. All right. I think one person has their hand up.
Sister Tahita has another question.
Mhm.
Sister Tahita, and then Sister Sharon. I'm not sure. I think Dr. Ramadan may have lost his connection.
That's what I'm wondering. I don't see him anymore.
Yeah, it looks like he lost his connection. We'll be looking for him to come back on, but in the meantime, if it's okay with you, Sister Sharon, we'll take this one last question, and then we'll turn it over to you and Dr. Ramadan for closing remarks, and then we'll transition to the chronic Arabic discussion. Go ahead, Sister Tawhid.
Yeah, assalamu alaikum. I like the part talking about the educational part because, and I think that educating our youth to the fact that using drugs and not eating properly may have an effect on your DNA that you'll transmit to your child, that in the future. It could have some issues with that. I know I tell some of the youth that I'm around that you're using this drug that you're using, and I don't know much about some of them. I think that some of them is targeted to a certain population specifically, and it might be laced with something. Even if it's not, you still don't know the effect that it has on your body and your DNA. And then eating properly, eating better, the right foods with the best nutrition, letting them know that when they start having children, that can affect their child. So I think that's important to give that type of education, And I wanted to also say quickly about the leggings again. That's a problem I dealt with when I was coming up doing, some ballet. And I know now that just the tightness and not being, your body not being able to take in oxygen like it should be, might be an issue no matter what you put before you put those leggings on, because the leggings is not letting nothing come in. So I just wanted to bring that out because you see a lot of that every day. Assalamu alaikum. Thank you.
Yeah. Can I comment on something I saw on a feed? I think it might have been Facebook. They said it was like a skit, kind of like you all did, but this was just you didn't see the person, but you saw this image of this young lady standing in front of an expensive sports car, and this was her father. She was letting her father know that she got an iPhone, and that you read that, and she got it. I did might tell it better than me. Yeah, okay. She got a cover and a screen to protect her iPhone and a cover. Long story short, he said that you paid a lot of money for that phone, and that phone has value to you, and so much value so that why'd you get a screen protector to protect it? I'm sure the manufacturer made that the manufacturer of that phone made that a phone, where it's a good phone and that it should hold up and carry its own, why'd you get a protector to protect it? Oh, because I want to, because I do value it and I want more protection. So I got a screen protector, I got a case to protect it. And long story short, you all know where it's going. He said that then I should have mentioned she was standing there in one of them tight. I don't think she had no leggings on, but it was a tight skirt, and it was tight everywhere, and it was showing a lot of skin. So he long story short, he was saying that if do you value that you should value yourself the way you value the phone? It was way better when he said it, but it was I'm just cutting it short. And she agreed. She said, yeah. And she does value herself. And I think you're saying that you decrease your value when your value as a person, or what God created you to be, you decrease your value when you limit it to, when you expose yourself the way she was exposing herself. And if you saw her, it wasn't horrible. It wasn't, for what's today now, I see some things that I'm going to find your mama right now because something is wrong with your head, the way you dress right now. I'm like, you're not supposed to, and they wear stuff where it's not even the designer designs it to make them look nude. And so that's horrible. Swimsuits have some protection, some covering, some conscious, but the stuff they wear, like the sister was saying, the leggings, that's not designed for that. And I forget what I said. I blamed it on something that's deeply ingrained into the Christian culture because we're not Christians. And y'all know this is Orthodox Easter, and I'm not meaning to upset or insult anybody, but because we're not Christians, we have a totally different perspective on that image. If God is half naked on a hanging from something over the ceiling, where we look up, if you hang a woman in a miniskirt and she not wearing underwear, and I know they didn't make underwear back then, you looking up her skirt and you seeing everything that we shouldn't, decent people shouldn't be looking at. And so, but if God is doing that, how can you blame the woman for going down the street like that? I don't blame the woman. I blame that image. God is half naked with a miniskirt on in church every day, and mama prayed to him, grandma prayed to him. Yeah, I don't have to agree with me one bit. I carry my burden like I carry just like Jesus carried it. I carry it by myself up that hill if I have to. But I don't blame them. And I don't blame the soldier that says, I'm gonna kill everything I see, regardless. Because his God is an image of violence, of serious violence and torture. God is the image of, and I realized it took me a lot of years before I accepted that they said, I said, well, no, they see Jesus like we see Jesus. You know, he's a servant of God. He's a holy righteous, but no, they see him as God. So I'm like, if God is violent, why can't I just kill indiscriminately? Now I love Christians and I know they sincere and they good people, the ones that are, and I know the love for Christ they have because I have the love for Esau, alayhi salam, for Jesus. I have a similar type of love, but the more and more I look at that image, I realize that that image presents a different application to or an expression in the person because it's in the image of a human being. You see, and once you put a human being on a symbol, and then there's so many subconscious messages. Just like even the image of the human being is the 90 degree. You know, we all 90, we stand upright. That's the image of the human being. And the scales of justice, the other image, the going on the horizontal plane. That's something that we can identify with. You see, you know, you take one extreme to the next, but when you put the message, you drive the message home when you put a human being up there. So what are we doing to that human being when we put them on that image? I heard that during Jesus' time, there wasn't even that image in existence. I heard it was a X was what they put people up on to crucify them. So it's so much that comes out, but I think we should be more responsible, knowing that the public has had that image before them for generations after generations after generation. And then when you have a people that aren't as evolved socially as a community, as African-American people up from slavery, we haven't had the opportunity to develop strong influences in our communities for good, then we have to take that for face value. We have to take it for face value. And I tell a little joke, but what I shouldn't tell, I probably keep the joke. I'll say that image, it don't fit in public. I think, because I know a girl that wore a fishnet. I do know a woman, and I'm not gonna mention your name because this was many years ago, that you got arrested by the police because you had no bra on under a shirt that had net-like shirt, and got arrested. What you think they would do if you was dressed like that image? They lock you up. You couldn't walk down the street with that. They say you got to put some shorts, some underwear on or something, man. You know, or at least don't walk up that flight of steps where people can see. See, the logic, most people don't think of it. They think it shows something that's civilized. So we have evolved as a society. We don't walk around in the jungle with loincloths on anymore. So the society, the mind of the society is conflicted when they see that. Yeah. And a lot of time the images are not a masculine image. I ain't never seen that image, 50 Cent or one of them big muscle guys, I don't see them using his image. It's a very feminine image. So how can we blame our young men when they want to grow up to be a minister and a pastor and they acting feminine? You can't blame them. Especially when mama is treating them like, way sweeter than they treated the girls in the house. I know some women that do that. They treat their son real sweet because they want them to grow up to be sweet. So we have to be socially responsible. And I think it's a shame on society. Now I'm saying something that I think everybody should agree with. You don't have to agree with anything I just said. You don't have to accept it. You don't have to even entertain it. And because it's this thing going around where people, I asked somebody, I've told several people, and this years have passed, but I realized some people won't even say from that persuasion the name Muhammad. I said, Muhammad means one who praises God much. What's wrong with saying Muhammad? Well, no, they just gonna say, because all my kids got names that are Islamic or a little different from what most people are used to. So they call them by their first name. But I've even had situations in our community where they drop the Muhammad. Muhammad is not an evil word. They will drop Muhammad and call you by your first name. I'm like, no. The last name honors the first name because it connects you to your mother, your father, your aunties, your grandparents. We need to, I want y'all to join me in this fight to have people respect our lineage. I don't care if your name is Smith, Abdullah, or whatever your name is. I believe that if we honor our family names, then we honor our ancestors. We honor the people that came before us, and we give the people that's coming after us, a path to follow, or So yeah, that's I can go forever, but I'm gonna keep making trouble. If I'm making trouble, this is trouble, and I say this to almost everybody I meet all the time, and I get some good responses, but most of the time I get exactly what you think I get. I get shocked, and they kind of like, they avoid the subject because they never looked at it the way I look at it. But a lot of people, I'm gonna let you know, I didn't start this. When we did the committee to move all race, I was a little boy, and a lot of churches, a lot of synagogues, a lot of religious institutions have all joined us and trying to find a more dignified, a more respectful way to present the to present the value of I call it that image because I don't even like to say, because I don't want no sound bites of kids repeating me and saying what I'm saying and causing confusion in anybody's household. So, but I've seen leaps and bounds made in our culture, in our society, and in the world to respect the true value of Esau, the God's servant, and I think we should just keep doing what we're doing. Allah did it. It's in the Holy Quran. You don't even have to come from your own mind. Most of what I'm saying, that's it. I'm coming from the Holy Quran, the logic and the compassion and the mercy. God is way more merciful than I could ever be. God is way more kind in the Holy Quran, the way he validates, where he says things like, it just was only made to appear that they killed him. But the bigger thing that Allah is doing is letting you know that don't your brain, like what Allah say, have they got it together yet? Don't your brain tell you that you can't kill God? It appeared you killed God, but you didn't kill God. So stop talking crazy and use your brain. But Allah is so kind and merciful. He tells us, trust God, but tie your camel. There's so much wisdom in that, because to a child thinks, oh yeah, because camel like to walk around like me. He's curious. He might run down there and hurt himself, fall down in the river and hurt himself. But to a grown adult says, sometimes you got to tie your camel because some other person may find reason to or the means to cause him to stray, to walk away. We as adults, we've experienced crime and criminology, and we know that people, if you don't put it in a safe or in a lock, if there's value, somebody gonna walk away with it. And so, the way Allah put it, he said, trust God, will tie your camel. It's such wisdom. It has respect. That's the type of leader Imam Muhammad was. When I was a little boy, I could tell he respected my intellect because I felt I understood everything he was saying. But when I became a teenager, when I became a young man, and once I got married, then I realized he was talking to me when I was a little boy at the same time he was talking to me as an adult and as a father. So that's the Holy Quran. That's the mercy that Allah gives. So we should always read the Holy Quran the way it's given and understand that Allah, the wisdom and the compassion, is above anything we could imagine. We cannot be him. So we have to trust him. Like, he's way more kind than we are. He's way more civilized, way more merciful, and he knows the future. So he knows if I treat these people this way, eventually they're gonna come my way. They ain't got a choice. So we have to trust the Quran, know that Allah speaks the truth, and try to read the Quran in the way that, and give it to other people the way that it was given to us. You see, because Allah is merciful, man. He did so much justice. I wouldn't have been nearly as kind if if I could tell the Christians and the Jews and the people that came before. I say, Muhammad on the scene now. What's wrong with y'all? Yeah, he done told you the truth, clear as day, clear as day. But what Allah does, he sees what we don't see. He don't see right and wrong. He sees justice. Yeah. And they're our brothers, the people of the book, we're not special. And I don't want anybody to think that I think I'm special or better than anybody. I could be dead wrong. And but Allah will show me, inshallah, if I'm right or wrong. But I think our society is going to evolve on the ability of us to use our brains for the betterment of the world. You think? I honestly believe that. And I say this little thing that sticks in people's head. I believe that whenever the world discovers a new technology, the old technology is no longer the main focus. So those images, whoever has those images out there, that shouldn't be the main focus, because now we got telescopes that shows us that we are not even a molecule in the scope of creation. We're just something that's so small and so insignificant that we should never have the arrogance to think that we have power in the scheme of the world and the creation. So the power don't belong to us at all. It's with God solely, so alhamdulillah. All right, thank you. I don't get to, my brain has this stuff up here, but I don't get to share it. So I appreciate y'all, and I apologize for going too long. I appreciate y'all, but this is therapy for me. Thank you. Alhamdulillah.
Alhamdulillah.
That was it on the.
That's me. That's good. That's it.
That was it for the questions. For the Muslim Health Consortium. At this time, Dr. Ramadan and Sister Sharon will leave it to you for your closing remarks, and then we'll transition to the next portion of our program, inshallah.
Assalamu alaikum. This is beautiful, and goodness is on the rise, as your father said, sir. And so you can reflect on the fact I'm an alumni of University of Islam, and Claire Muhammad. You can see these children growing and just doing so much, in leaps and bounds, and helping in their communities and becoming leaders. So we're going to be okay. Families are so important, and that's why. Education, Islamic education, is so important, and this is why. A positive self-image, because you were raised that way, and it doesn't go away if we do it right, inshallah. Dr. Ramadan? Alhamdulillah.
Allah, I think it's been said. I think I've said it, and I just say also that I'm proud to be a member of this community, and I feel too I've grown up in it. So may Allah continue to bless us in all the efforts that we're doing, and alhamdulillah. Thank you.
Alhamdulillah. Again, we thank the Muslim Health Consortium for their presentation. You can contact the Muslim Health Consortium, I believe is contact your mhc@gmail.com. Is that correct, Sister Sharon?
Yes, sir. And did you want me to attach the PowerPoints somehow in the chat, or how do you want to do that?
I'm sure they'll be asking us in the chat for that. So if you don't mind, Sister Sharon, as always, the viewing audience, when they present, the majority of the time, the Muslim Health Consortium provides their slide presentation in the chat. So you can look in the chat. Usually they'll put it in a link form. So all you have to do is copy the link or tap in the link to access the presentation that they presented today, inshallah. Again, you can contact the Muslim Health Consortium, or either you can support them by see how you can help and assist them in their work by reaching out to them at their email at contactyourmhc@gmail.com. Or if you have questions, you can submit them. Like if you have questions now, you can ask the questions, and inshallah, if possible, if they have time, they'll address them for the next first Sunday, or even before then, because they present on various programs throughout our community. So please send your support and your questions and comments to the Muslim Health Consortium at yourmhc@gmail.com. Again, thank you, Dr. Ramadan, Sister Sharon, and Sister Maddie for your presentation. At this time, we're going to turn it over to Imam Elam Muhammad for the Quranic Arabic discussion.
Yes, sir. Assalamu alaikum, brothers and sisters. With Allah's name, the merciful benefactor, the merciful redeemer, I testify that there is no God but Allah, and Muhammad is his messenger. Thank you, Dr. Ramadan and Sister Maddie, and I forgot the sister's name right now. All three of you for the excellent job that you did. Excellent presentation. And thank you, Imam Muhammad, for your comments. Imam Warfi Muhammad II. Okay, this is the Quranic Arabic discussion. And the class is based upon the class that Imam Muhammad taught from 2001 to 2006. Basically right here at the Mosque Cares. And then as the class got bigger and bigger, it moved out. And then I think the last site was Masjid Taqwa, where Imam Dr. Ramadan was Imam at that particular building. Today we're going to deal with the chapter 96, and it's entitled Alaka. And it's the first 5 verses that are revealed through the angel Jibreel to Prophet Muhammad. And he pressed the Prophet Muhammad 3 times while he was in the cave of Jabal Nur, the mountain of light. And the Prophet said that he could not read, and pressed him 3 times. And then the revelation came out. Ikra bismi rabbika alladhi khalaqa. Khalaqa al-insana min alaqa. Ikra wa rabbuka al-akram alladhi allama bil qalam. Allama al-insana ma lam ya'lam. And so these are the first 5 verses that were revealed. 5 is very important. You have your 5 senses, and so the 5 senses. Once you turn on from the physical level to the higher level, your senses are heightened, and so these are the first 5, and then the rest of the verses were revealed later, and then added to this particular chapter 96. And in this verse, which we're going to go into as much as we can, basically the prophet is told to read, recite, or proclaim. That's the definition of Iqra, or Qara'a. Qara'a is the 3-letter root. Qara'a, 3-letter root. And then also it says he was taught by the use of the pen, and so it means that he was taught to write. And we know that the prophet, they say that he was unlearned, and he was from the society, or the tribal members who were unlearned. They were not educated. But the prophet was a businessman, and he traveled around, and so he had to sign contracts and make contracts and do business. He traveled all around different countries and so forth, and so the Imam Muhammad mentioned that the Prophet Muhammad did not learn any scripture. Nobody taught him any scriptures. So he did not know how to read the scriptures. And then also he did not know how to read the signs in the creation. And so that's to start out with. Now, in the, let's see if I can do this. I usually just, okay, Imam Adil, could you assign me as a co-host so that I can bring up the whiteboard and also,
Yeah, you are the co-host.
okay, let's see. Only the host can share in this meeting. That's what it's saying right here. And if I can't get off there, that's no problem.
No, it's okay. Let's see. How many devices are you on? Keep talking so I can.
I'm on 2.
Okay, so let me make sure you got the right one for you.
Oh, yeah, the one with me talking, and you can see my picture. Okay, I think I see it right now.
Okay.
Yeah, so it comes up. Let's see if I can pull this up first. Google Drive. See if I can do that. And basically, I wanted to slide my picture over, share screen, open. Okay, this is a verb sheet that I sent out. This is not the updated version because at the top it has a few things that is not correct. But when you look at it, it's dealing with the root word or root verb fa'ala. The Arabic language is pretty much based upon a 3-letter root, a verb, action. And so the reason I brought up this chart, it has on it your personal pronoun as you to the right above it says attached pronouns. That's not correct. And I just hadn't had time to take this one down and put the correct one in my Google Drive. But where it says we see the personal pronouns, which is Anna means I, Anta means you, Auntie means you, female, Anta means you, male, Hua means he, Hia means she, Nahnu means we. Then you have your duals and so forth. Usually when I have new students that come into class and even regular students, we stop at about 6 because you have to learn the vocabulary. You have to learn how to write and read what this is. For example, if I say I in English, I should be able to write it out in my mind and on paper. Aleph with a fatha, a noon with a fatha, aleph with a fatha, and that's ana. That means I. Then the next one is anta. I should be able to write out aleph with a fatha, noon with a sukoon, ta with a fatha. That's anta. Anta means you, male. Likewise, here, hua, here, and here, hua, and here. Then the next thing is once the students learn the personal pronouns, next they have to learn to the far left. I have a whole little pamphlet, 5 pages that has the personal pronouns and attached pronouns. To the far left, you have the attached pronouns, which is my, yours, his, hers, and ours. And these attached pronouns attach to 3 things. The Arabic language is made of nouns, verbs, and particles. And a good percentage of the particles in that bag, in that label, is preposition. So the attached pronouns, these are the attached pronouns. They're attached to those 3 things. One is they're attached to the noun, they're attached to the verbs, and they're attached to prepositions, which is part of the package called particles. So those are 3 things that these attached pronouns are attached to: noun, verbs, preposition. So once you now learn the pronouns, then now you have to learn how to conjugate the verb fa'ala, which be if you can conjugate the verb fa'ala, then you can conjugate any verb. So for the most part, there's some derivatives, but so it starts with the past tense. So the From the past tense, you get the past, and from the past tense, you get the present, and from the past tense, you get the future. So you have to learn the past tense. And so the conjugation of fa'ala, the three letter words, fa, ayin, and lam, you have fa'altu, ana fa'altu means I did, anta fa'alta means you did, masculine, anti fa'alti means you did, female, huwa fa'ala, he did, hiya fa'alat, she did, nahnu fa'alna, we did. So you learn the past tense. Then after you master the past tense, now you got to learn how to do the present tense. And so you go one step over. And it's a little different format. And I'm getting to my subject, but I have to get there. Then the present tense has got af'alu. So that means the present tense means to do. Ana af'alu means I do. Anta taf'alu means you do. Anti taf'alina means you do. Huwa yaf'alu, he does. Hiya taf'alu, she does. Nahnu naf'alu, we do. Then after you get past that, then you teach the command form, and it's only five words really, and these words basically say do. You do. Now, if it's two, then there's another word for you do, and if it's three or more, then there's another word for you do. And so the first one is if'al, and that's singular for one person. If'al means do. If'al. So that's the command form. So now I can go back to where let's see, stop share. Okay, then bring up the whiteboard. And I'd like to thank, I hope this is working. Oh, this is this is the, I think a deal for fixing my whiteboard, the old classical form. However, when we come into the Zoom of the Mosqueers, they have the updated form, which things happen that don't happen from the classical form. That's one thing. They in order to sell a product, they constantly put innovations in it, and a lot of times the innovations make it much more complicated than what it was when it was working perfectly the first time before. And in the business to make money. So yeah, somebody just put a line on my board, and I see. All right, let's see what we can do. If not, we'll do it mentally. We want to go to the first verse of where it says Ikra. You don't see it. Let's see. Let me erase this. Okay, try it again. Okay. All right. Let me do this one more try. It's a little thinner than I want. That's okay. So you don't see this right here. You see a wasla, or a little sign above the aleph. And this is what it is. Ikra. Ikra. And the reason I went to the verb form fa'ala is that this is the model for the first command form. If'al. So Ikra, and If'al is it's in that same form, which means one means to do. This one means read. Now the three-letter root of this word Ikra is the Qaf, Ra, Qara'a. That means he read. He read. So it's along the three-letter root of Fa'ala, which means he did. So from this point, now we learn the verb. The next thing, you have to become proficient in our class with the dictionary. So we first start out with teaching the alphabet. Then after we teach the alphabet, we teach you how to put the letters together, the letters of the alphabet, put it together and make words. And then after you learn how to do that, we start teaching you grammar. Imam Muhammad said that once you learn the alphabet, start learning grammar. We have a unique thing. There's grammar books out there, and you got to go from chapter 1, chapter 2, chapter 3, and so forth. And verbs is like in chapter 20. Well, we start you off right off the bat with verbs. And then a lot of the things that in the dictionary, it's almost like chapter 20, because if you don't know the three-letter root, then you cannot use the dictionary. We start you right off using the dictionary. Imam Muhammad, he used the Arabic dictionary, and then when it came to the English language, he used the English dictionary, and he looked at went through all the levels of the English dictionary, just like he did in the Arabic dictionary. So when Imam Muhammad spoke to us in English, he was able to penetrate right to our soul in the English language, his tafsir, his message. And then likewise with the Quran. The Quran, the vocabulary of the Quran is so deep that it takes many words just to translate some of the things that's within the Quran, a lot of the things. So for example, Qara'ah, if you look it up in a dictionary, it means proclaim, it means read, it means recite. And read and recite is probably the best. And then I have a app called Quran Tafsir, and you have 3 translators. One is Say International, that's the more modern people, the 3 women who converted to Islam, and they study the Arabic language, and they have a recitation, or not a recitation, but a translation of the Quran. So they say recite. They use that word. Yusuf Ali say proclaim. And then Pickthall says read. And so read is probably the best definition, but you have to understand the rest of them too. Kara means he read. Hua fa'ala means he did. Kara'a. And then, so we have it in the command form, which is Ikra. All right, so next, what you want to do, and I got about 15 minutes, so that'll work for what we got to do. From this same word, Qara'ah, you get the word Quran. And Al-Quranu means the Quran. So it's a noun. Al-Quranu means the Quran, or the reading, the recital, the proclamation. And so the Quran. And It's a noun. Al-Quran is a noun, and the rule of nouns is that they're definite and indefinite. In order for the noun to be definite, you have to have al, which means the, and the last letter has a dhamma. Al-Quranu. It's not Quran. It's Al-Quranu. And then when it's indefinite, you don't have that alif lam. You have a double dhamma at the end of over the noon, so it's Quranun. But if you rest on it, Quran. So that means a recital, a reading, a proclamation. So it starts out with Ikra, a command form, read. Then there's a sheet that I've sent out to our class, and there's two sheets that we developed over a period of time as a class that you won't get anyplace else. And in fact, I put at the bottom that's copyrighted, and that the one sheet is that it narrows your focus from the broad Arabic grammar and words to reading the verses of the Quran. That when you look at the verses, you look at 5 things. The first thing you look for is a sentence that a complete thought. Cornell Abdul Salam quit writing on my board. And so okay, so you have a complete thought. And this sentence does not have a verb you can see. But you have to, for example, if I say, let me do this. I got Ana Muhammadun or Ana Muhammad. It means I, Muhammad. But to translate it, you want to use the best English construction that you can. And so you have to say, I am Muhammad. So this is a sentence. I is the subject. You don't see the verb, so you have to put am, which from English, and then Muhammad is the name. I am Muhammad. And so that is a sentence that that is a complete thought that does not have a verb that you can see. So it's called a nominal sentence in some Arabic books, called equational sentence, and a noun sentence in some books. I just say a sentence without a verb that you can see. The next thing, according to the sheet that I sent out, is that you have a sentence with a verb. So that means you have to have a physical verb that you can see. And then the next you look for, again, when you're reading verses of the Quran, the next you look for prepositional phrases. Well, you have to know what prepositions are, and then you have to know what those prepositions are. And in order to have a prepositional phrase, you have to have an object of the preposition. And so that becomes a prepositional phrase. The next you have to, you look for what is called a Adalpha structure. Adalpha structure is a complicated sound, but it shows possession. So roughly the first 2 words of the names of the chapters of the Quran, you, for the most part, you have an Adalpha structure. Suratul Fatiha, the chapter of the Quran. Suratul Baqarah, the chapter of the heifer or the cow. And so that's an Adalpha structure. And then finally, through an adjectives. So you look for those things when you read just one verse of the Quran. And so that way it takes you out of many grammar things that's in English that they have in Arabic. It narrows your focus to, if you see those 5 things, for the most part, you could read the Quran and understand it pretty well. I also have a sheet that I says patented, is that when we take one word, like Muhammad, or an attribute of Allah, and we start working with the three-letter root, we teach the rules of noun, then we teach the three-letter root, how to, from that three-letter root, you're able to do use the dictionary. Then from that three-letter root, you're able to conjugate it in the past tense form. And then you start going into other things and other rules of grammar. So we're able to teach about 60% of the grammar in about an hour and 15 minutes, which is about 60% of a Arabic class in college that you have to travel roughly 2 days a week for a 2 or 3 hour class. And you know how much time it takes to travel depends. If you have, in my case, we had to travel almost 60 or 70 miles down and 60 to 70 miles back. Then I had to go and work. Me, my wife, and Brother Fahim and his wife, sister Zakia, and sister that passed away, Sister Jamila. We traveled down for almost 2 years, and each term was about 3 months. So we're able to teach the rules of grammar with one word in about an hour and 10 minutes, about 60% of it. Will you remember everything? No, because you have to learn the words, and then the words have to stick. So you can only learn a little bit at a time. Now I just showed you a simple sentence. So going back to, so I got about 8 minutes, so I'm gonna have to speed this up. And if I can get this one sentence done, that'll be fine. So first you have the command Ikra, means read. The next you have, let's see. You have be. I'm gonna separate from that from the other part of the word. Be means with or by or in. So it's a preposition. So that means that if you have a preposition, then you're going to have an object of the preposition. And what is the object of the preposition? Is, in this case, it's really al ismu, but for a reason we'll get to it, it's ismu. Ismu means name, and because a preposition affects the noun, ismu is a noun, so the be affects the last letter, and so it becomes be ismi, and the rule of tashweed allows you to attach the be. We'll attach the be. So you attach the be, then you have to, rules of tashweed let you, because both have be and then it and then e, is let you drop the other e, and then you go right to the scene. Bismi. We're familiar with this. We say Bismillahi. Bismillahi. If I had Bismillahi, Bismillahi means with the name of Allah. We're familiar with that. When we say Al-Fatiha, Bismillahi. And what we have, you have a preposition that is attached to an Adelphi structure. The Adelphi structure is Ismullahi. Ismullahi. So now you have a prepositional phrase that contains an Adelphi structure. So that's okay. So the difference between Bismillahi is that you have Bismi Rabbika. Bismi Rabbika. So instead of Allah, you have Rabbika. And Rabbika Rabbika is really Arabu. Arabu, which means the guardian evolver, the cherisher, sustainer, Arabu. That's definite. Indefinite would be Rabun. Rabun. So the guardian evolver or Rabun, a guardian evolver. So we have that. That's next. Rabbika, instead of Allahi, is Rabbi. It's Rabbi. Means the Lord. The Lord, with the name of the Lord. However, you have an attached pronoun, as I mentioned. Attached pronoun, you have to take off the aleph lam, and it will be Rabbuka. You attach the attached pronoun, it'll be Rabbuka. Okay, it's still definite. Our Rabbu is the Lord, but when you attach your attached pronoun, it's still definite. It's your Lord, so it's specific. So it would be Rabbuka. However, it is part of a Dolphin structure. The of is understood, so it becomes Rabbika, with the name of your Lord, with the name of your Lord. And yeah, a couple more minutes, I should be able. Then finally, you come up, okay, read with the name of your Lord. Then there's a word that means, oops, let me erase this. Now you're going to come up with a verbal sentence. We did command form is verbal, but it's just at the beginning of the sentence. But you have a prepositional phrase, which within that phrase is an Adolphi structure. Now you're going to come up with a sentence with a verb. First, you have to know this word, alladhi. It means who or one who. A lot of times you'll see alladhina, which means those who. Alladhina. This means one who. Then alladhi, one who. Now you got a verb, and it completes the thought, really. Alladhi khalaqa. Khalaqa. We have the three-letter root of al-khaliqu, which is the creator, al-khuluqu, which is the character. The Prophet Muhammad is khuluqul adhim. He has a mighty foundation of character. And the three-letter root is khalaqa, which is created. And so he's a mighty foundation of creation. So khalaqa, and we could conjugate it like fa'ala. It will be ana khalaqatu, anta khalaqata, anti khalaqati, huwa khalaqa, hiya khalaqat, nahnu khalaqana. So in this right here, khalaqa really means he created, but what takes the place of he is alladhi, who created. So the subject is who, then khalaqa is the verb, who created. So in conclusion, this one verse has a command form, and then it has a prepositional phrase that includes a Adolphi structure, which B is the preposition. The Adolphi structure is ismu rabbika. Then finally, alladhi khalaqa, a sentence with a verb at one who created or who created. And so verse 2, you will see you will see he created the human being. Okay, that is a verbal sentence. Khalaqa, who is understood, al-insana, the human being. Then min alaqan, that's a prepositional phrase. You have min, which is a preposition. The object of the preposition is alaqan. Then the number 3 is the Ikra or Rabbukel Akram. Again, you have the command, but then you have where means and Rabbukel Akram. Here you have a sentence that the verb is understood, and your Lord is most generous, most bountiful. You don't see is, but you have to use that. Then again, you look at number 4, Alladhi Alam bil Qalam, one who taught with the use of the pen. So again, you have a sentence with a verb that you can see, Alam Alama. Alladhi is the subject, Alladhi Alama. Then you have a prepositional phrase, bil qalami, or with the pen, taught with the use of the pen. Then it says, Alam el insana malam yatlam. Alamma, the subject will be huwa. You don't see it, but it's in that form. And it has a shedda over the lam. That means it's stressed. It's pressed upon. It's strong or strengthened. Huwa, really, is huwa alamel insana malam yatlam. He taught the human being. Ma means what? Lambs mean to make it know or not. A yat lamb. He taught the human being what the human being did not know. So that's the best that I could do. Hopefully you picked up something, even if it's just your personal pronouns. Anna, anta, auntie, hua, hia, nahnu. All right, thank you. I am done. And we can close this out. Stop share. All right, that in the half hour, we did a lot. And you have to take it in parts. That which you don't know, you if we gave you new knowledge, you add it to the knowledge you have, and it's a step-by-step process. It's just like you have a big giant piece of big giant cake that was baked. You can't eat the whole cake. You have to take one part at a time. So light upon light. So knowledge upon knowledge upon knowledge. So step-by-step process. Assalamu alaikum, Imam Adil and Imam Warfi Muhammad II. This concludes the Quranic discussion. And you can join my class. Anybody can join my class. Believe me, it is an accelerated class. And we got almost, I would say, about 30 people. I say a good solid 20 that can pretty much teach my class the way it is now. But we got about 30 people, and many of them is on the came from the first Sunday, and many of them are on the first Sunday, and they are part of the Lifeline. And so, and we had Juma. We had we don't have as many people as we had before, but I was so proud to see Sister Esther, Sister Camilla, Sister Tawhida, Dr. Sharifa, and Sister Esther's daughter Camilla, and then my wife was here, was able to make it. That would have been, I called them all Dr. Sharifa, Dr. Esther, Dr. Tawhida, Dr. Camilla. My wife would have been Dr. Oh yeah, and Sister Dr. Lynn. Dr. Lynn. There was if he had made it to Juma, we had them out in Juma. And of course, Adil, he's a scholar in his own right, and but he picked up some things from me. And his brother, Hafik Muhammad II, he used my foundation, you know. And but he has, but everybody, Imam Warfdeen, he was born. His father was teaching there. He was born in there, and I know that from the product of his children, he had played the Quran, and real low, as the Imam mentioned, you could play it inside your house, and every day learn a little bit of the Quran, and it impacts his children. And all of his children, they're dynamic. They got A's in classes and stuff like that, and that's because of the Quran. The Quran will accelerate your mind. The Quran will make you intelligent.
Yeah, Mila, thank you very much. We're gonna, and if you don't mind, Mila, voicing your email address for our YouTube audience, and also put it in the chat for the Zoom audience for those who would like to join your Arabic, Quranic Arabic class. If you just voice it and for our YouTube audience to hear, and then also just place it in the chat for our Zoom audience, please. And then now we're going to transition to the next portion of our program, which is going to be the business and technology presentation with Imam Ismail and Eric Shamsuddin. So at this time, we're going to turn it over to them, inshallah. Imam Ismail.
Assalamu alaikum.
Wa alaikum assalam.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. I bear witness that there is no God but Allah, and I bear witness that Muhammad is his messenger. I'd like to thank Imam Warathi Muhammad II, Imam Adil, and Mosque Cares for allowing us to be here this afternoon. We appreciate it, and we pray Allah that the information will be helpful. One thing that I'd like to stress to the audience is that if you have grandchildren, you have children, you have parents that have nieces and nephews, please put them on so that they can get this information. Based on what I've heard during the health conformium, they were excellent in terms of, excellent in terms of presentation, as well as Imam Elam. So it is important that we have the young people tune in. So you need to contact them. They have phones, they have different areas. They need to listen to the information that's being presented, because it's very helpful as they to grow and develop for their life in terms of how they make it.
You want this?
So please, if you can take a moment to go and reach out to them so that they can get this information, that is very important. Today, we have with us our host, Eric Shamsuddin and Naeem Najib, who is excellent in their way of making the presentation today. We will hear from Eric Shamsuddin on planning and savings, which is most important. And this is some areas that young people, especially the teenagers and the young adults, they need to have this information so that they can be able to advance their lives and to be successful in their upbringing. So I would like to turn this over to Eric Shamsuddin, who is knows exactly the context of his experiences over the life expansions. So we would like to hear from him.
Thank you very much, Brother Imam. With Allah's name, the merciful benefactor, the merciful redeemer. Again, we would like to thank the Mosque Cares, Imam Warithuddin Muhammad II, Imam Adil Muhammad, and the staff for allowing us to participate in another First Sunday community service program under the business planning. We would like to discuss today the personal finances, with emphasis on savings and goals and objectives. Inshallah, we would like to make these steps. We're only discussing simple steps. No need for fancy companies, no need for big words or any type of companies that are listed on many of these stock exchanges or commercials. We're not here to promote any of them. We just want to make something that's simple, a plan that we can live with. And of course, we will do this, inshallah. Now, one of the things that we need to do when we think about anything, when we do anything, is to have intentions. What is our intentions? We make our intentions for just about everything, for prayer, for most of the activities that we do in our daily lives. when we make our intentions to reach and do the goals that we wish to do, we review our intentions also with our finances. What is our intentions? What do we plan on doing? What are the steps? What is the status? What is the status for good health in our finances? Good economic health. What is our financial footing? What type of where do we stand to assess our stuff? And that leads into the next goal is to assess our financial position, where we stand, what we'd like to do, and what is our goal. A key component, if we divide these into two, we can divide a couple of these programs into two sections, income and expenses. First, what we would like to do, and I'm reading here from my notes, is when we talk about savings, when we talk about planning and financial planning, a lot of people become confused as to what we'd like to do or where do we go. And we would like to make it fairly simple. The first thing that we would like to do is to assess our financial footing with regards to income, revenue, or things that we have coming in to our household. And we should have pen and paper, and we should write down some of the things that we have. One of the things that we should do is to look at all of our income, everything that comes into our household, our household income, maybe on a weekly or a monthly basis, what we have coming in on the month. And in a lot of cases, for most people, it's wages, salaries. Some of us who are older that are retired, we have 401ks, retirement income, Social Security, and maybe some interest on certain bank accounts and on other things. We can list it weekly, but I think monthly is the best reason, monthly is the best outcome so that we can have these things, we can see these things on a monthly basis. And next, we should also look at our expenses. And I think this is key. After we list our income, we can now look at our expenses and what we spend monthly. And I would like to break down the expenses into two additional topics. What's needed and what's also extra. Now, the first section under the expenses needed, meaning these are things that are part of our existence, part of our daily household. In the example that we have are rent, mortgage, food, utilities, gas, electric, water, commutation, getting back and forth to work, gasoline, insurance, childcare. All of these things are required to have in our household. Oh, and one other thing that's also important, we just came back in, is our taxes. Our income taxes, which we just came from last month, which is something that we also have to take into consideration. Now, also on that same subject with expenses, what are our extras? What are the extra things that we spend? Entertainment, meals, coffee. Can you imagine? You need 5 or $10 or maybe even a credit card to buy some of this designer coffee that's that we have out there. The streaming services for internet, well, I don't know, internet and information. You know, you can think of it as extras, but we really need to have internet so that we can be part of the society, so that we can get as much information as possible. Now, once we've done that, we can combine the two, you know, what our income and what our expenses are, and if we subtract the expenses from our income, if we have a positive number at the end, that means we will have a surplus. That means we have more money, that we have more income than expenses. And if we have a deficit, that means we're spending more, or a negative number, that means we're spending more than what we are bringing in. And that is the case with a lot of households, a lot of families. They become to be very short on the expenses and stuff that we have. And one of the most important things is savings. That's a big component with saving a bit of money each and every week. Now, if we look, I've done some simple math. A $20 a week savings every week for a whole year comes to $1,040. A $25 savings per week at 52 weeks for a whole year comes to $1,300 for the year. At $50 a week, the multiplication comes to $2,600. Now, if we take the expenses or the dollars savings even further, a 10-year savings of $1,040 per week comes to $10,400. If we saved $1,300 for the year for 10 years, we're talking about $13,000. And at $2,600 for the year, at 10 years is $26,000. Now, who would refuse those type of funds annually or in the savings? Now, one of the things that we also should have too is a word that a lot of us have to consider, and that's discipline. You know, discipline is required to achieve our financial goals and our objectives. There's a prayer that is said that Allah, I don't have the quite wording of oh Allah, relieve from me debt and the oppression of men. We have to manage our income, our spending, and our savings. Savings makes us less stressful. We see that there's a lot of stress between our spouses, between our wives, our children, and we don't have the understanding when we have those type of things in our lives. So, I mean, there's a lot of stress when we have not being able to take care of our needs and have better conversations with our family members. The Prophet Muhammad sallallahu alaihi wasallam, the Prophet Muhammad was not a man of abundant wealth, but at the same time, the Prophet Muhammad was not a man that was poor or of very minimal means. He was able to take care of himself, and he was able to take care of his family. And we as individuals should take a page from the Prophet Muhammad sallallahu alaihi wasallam, because what was he but a man who took care of business. He was a businessman. He was a professional in his own right, as he was today, and or as many of us are today, buying, selling, doing things, and he was able to make a modest and maybe even a comfortable, not modest, but a comfortable living for himself and his family. And many of us are in the positions that we do so today. The problem that we see with many of people in our community is that when we reach a certain level or a certain age or a certain time in our lives where we look into our finances and we make a certain amount of money, we may have good incomes, we may have good houses, we may have good cars, we may have good clothes, we may have all of the things, but we're not financially secure. If we lose our job, or if the company that we work for goes into another direction, or takes a turn for the worse, or if we have health issues, if there's a certain sickness that may come to ourselves or to a family member, we may not have the means or the objectives to take care of those things. And that comes with another point that was brought by the speech writers and the reviewers of my talk today, which says that we should plan. We should plan and take care of certain things, not just in finance or in savings, but in our own lives, in the things that we do amongst ourselves. What is the talk is fail to plan, plan to fail. I think I have that right. If you fail to plan, you plan to fail. So financing, personal finance is all about what? It's about planning. It's about what's going forward for the next part, for our lives, for our future. And not just for ourselves, but for our families, for our spouses, for those that depend on us. And not just in our families, some of us that own businesses, some people that employ tens of people, hundreds of people, maybe even thousands of people. A lot of times businesses fail, and not just small mom and pop or small businesses, storefronts, but big corporations. Their planning and their outlook on certain things were not looked at properly, or not looked at with emphasis on what do we do if this happens? What happens if we don't do this? Or what happens if this happens? We know that we can't be prepared for every single event that happens, but Allah subhanahu wa ta'ala says that if we keep ourselves planned, or keep ourselves always in the position where we know that certain things can happen, and to have reserve, to have a reserve, to have something that says always that we can rely on to help ourselves in the event that something should happen, or that we have a certain situations where we may not be able to continue. Allah subhanahu wa ta'ala may take a certain family member or ourselves out of the picture. What will happen with our legacy? What will happen with those that we leave behind? How will they move forward? So one of the things that we have to look at is planning. And a lot of times in our community, in our certain situations, we don't have the tools, or we don't have the insight to plan and to go forward. And those are the things that we have to look at when we do certain things. And we also hear about the big company. Well, you know, I save my money. I know what I'm doing, or this what you're saying to us, Brother Eric. This is very simple. This is not a rocket science. And to your point, that's correct. It's you know, our talk is not supposed to be where it's complicated. We hear on the TV, we hear companies that talk about management, wealth management, you know, the big corporations. I have them listed here. I won't mention their names because I don't want to promote their names, but at the same time, well, you know, this is wealth management. They give you a whole complicated or a whole list of things, or this is what you have to do, and they give algorithms, they give certain prospects, and really, when you hear the word management or wealth or anything like that, it goes back to the four-letter word that we used before: planning. And a lot of times people like to make things complicated or sound very impressive. There was a relative, a dear uncle of mine, who said, make things simple, break it down to its lowest common denominator. Make things simple. And when we plan and when we do certain things like that, our planning becomes easy, or it becomes simple to the point that we all can do this. A lot of times, children and young adults follow what our parents, what our fathers, what they do. And if we are the examples or the leaders going forward for our children, or for those who are dependent on us or who watch us, maybe it's not just our children or those young adults, could be our employees, could be the people who work for us or our co-workers. And we see the planning and the things that we do amongst ourselves. And this and the information that we have is not complicated, and it's not to the point where it's something that needs a whole lot of planning and stuff like that. We try to make things so that it's simple and bring things that are important. Now, I would just like to bring forward the pages or the keywords that we said previously. Our intentions. When we talk about planning, financial planning, what are our intentions? What our financial status, what are our goals, and what we have for improvements. There are times where, well, I have extra money, or I have extra income, something that had not been calculated at the end. You know, what do we do with that? Do we save it, or do we run out and spend expensive clothing or jewelry? Sometimes we may need to save that. The next word that we said was assess. Assess ourselves. Take a look at our position, where we stand. You know, get our income, list our expenses, and group needs, group them by needs and extras. The word surplus and deficit. What's money left? But this is particular money that's left over after all expenses. Money that's left over is a surplus. Money that's not left over, or if we spend more than our expenses, then that means we have a deficit. Then that means we may have to get a plan where we may have to cut back on certain things tried so that we can have not have a deficit, not have more money, have more money to be spent. We also need to account for, now there's one thing that I haven't mentioned. Suppose we do have a deficit. Suppose that there is, wow, I'm spending more than I'm bringing in. And sometimes we have to look at one thing that is important to us or one thing that we cannot move back is our time. What do we do with our time? Well, I work hard. I work a lot of hours and stuff. And I just can't, I just can't make, on my one particular job or whatever it is, I may not have the time. So we look at ourselves and we say, well, look, if we work a 40-hour week over 5 days, and we say that what the math, I believe, is 100. Well, anyway, what I'm trying to say is, if we are not bringing in enough money with one job, maybe we may have to do something else. Maybe we may have to take a second job. Maybe we may have to do a little more. Maybe we may have to make a personal bit, something personal where we may have to bring in additional income. Maybe at night, I remember during a lot of times, a lot of the brothers in the Nation of Islam, they had additional jobs. They had second jobs. I remember my father selling the newspapers at the end, in addition to the job that he had, and he worked. I don't know what his second job was. We were young, but I believe he had a second job that he worked on during the weekends. So there's something here that we may have to do in terms of bringing in additional funds. So also, and also we need to have goals. We can set short-term, mid-range, and long-term goals. These are things that we may want to keep together and do what's necessary. Sometimes the goals can be at the end of the week, the end of the month, the end of 3 months, 6 months, a year. And then what happens, then we can track our progress, see where we go with what we're doing. And also discipline. Discipline is a very important word that we have in terms of whatever our plan is, we have to stick to it. We should stick to it, stay with it, go forward, and try to be as close to what we have as possible. Sometimes there are deviations. There are certain times where certain things may come up where we have to go in a different direction. But whatever the plan is, try to stick to it as much as possible. And lastly, review. Review your finances, review your information, review your positions periodically. If you have to make changes, do so. If you have to have flexibility or have flexibility, do that. And also, creativity is also a good understanding with regards to things. Sometimes we have to be creative. Sometimes we have to think out of the box. Sometimes we have to do things that are a little different, not crazy, but to the point where it may make things something that we have not thought about, and it may help us with our particular things. So I would like to bring to the attention that planning, the emphasis on planning is very important, not just on finance, but in our personal lives, in order to do certain things. And if we realize that we plan and we do certain things, we become more effective, we become organized, we become more skilled, And we will see that when you have those particular things, others will follow, others will take notice of what's going on. And, I think those things will be at a great success to everyone. So I would like to bring this topic, or at least my portion to a topic, to a close, and hope that what we said has some benefit, not just for the listening audience, but for those that will follow behind in our footsteps and observe us, and hope that we can be the best examples to those things in the future. I'd like to thank the audience for listening, and I turn it back to Imam Ismail Shamsuddin, and I will remain for any questions that may arise from this conversation.
Thank you, Eric Shamsuddin. I would like to add a couple of comments. The comments that I'd like to make is the fact is that when we talk about planning, you specifically mentioned a lot about the financial end, but there are general planning that have to come into focus here. The general planning is planning for the day. Exactly how are you going to get through the day? It should be a plan of how it's not all about finance, but it's also about training yourself to be able to know exactly what you are doing in the course of the day. How are you going to go when you get ready to go to work, or you're getting ready to go to the school? Do you have your day planned out for the day? So that the general planning has to be in terms of what you're planning on doing from day to day, not just about the finance, but it's also the general practitioner of the finance. So my question to you is, how did you get to know about financing, or how did you get about the knowledge about planning, and how did you get to where you are today? What about that?
Well, Imam Muhammad said quite some time ago that Allah has blessed me with a good example. And the example was
that was the Imam said that, or who
yes,
said that?
Imam W.D. Muhammad.
Told you that?
Yes, he told me that directly. He told me that at an event in Edison, New Jersey, or Piscataway. It was somewhere in New Jersey.
Yeah, it was Piscataway.
Piscataway, and it said that Allah has blessed you with a good example, meaning that I was able to look at the people who are around me, and I took observations, meaning that I was able to see how my parents saved, how my mother saved, how my father went to work, how my uncles had businesses. He had his business, and I also looked at their appearance, my parents' appearance. They were always in business. They were always were a business attire when they conducted business. They were always look professional, and that was something that. And they also had taught us, instilled us with savings. Also, my our grandparents also was a part of showing us how to save money, how to do this, and they were not people of tremendous wealth. You see people with billions and millions of dollars, and they were not of those beings to that extent, but they gave the insight on what it is to be comfortable in what you're doing, and not realizing that, but those were the same concepts that our dear beloved Prophet Muhammad sallallahu alaihi wasallam did, and lived a comfortable life. Now, there's nothing wrong with having more, or having the expenses. Allah subhanahu wa ta'ala does bless some with more than others, but that doesn't mean that their lives are any better or any glorious than what the average person or the modest person is. So how I got that the understanding and the business that I had is based on observation and then put it into practice.
Okay, so the thing that I want to address to the younger audience is the fact is that if they're planning for their education to go either through college or go to a school that will have a trade. These are important things. Everyone can't go to college with their academics, but some of them can go to the college that will be able to, for them to get a trade, or they can go to a vocational school so that they will be productive in the community. So they have to plan for that. So how about the planning about that in terms of the education, in terms of the finance that will enable, people use a lot of credit cards and they're overwhelmed. They don't have to have a deficit. They can be able to use a credit card to be able to balance their finance out and then pay the bill later. So, that we have to have a situations where there's a balance here, in terms of planning, if you're going to plan and if you're going to use the credit card, you can't pay the minimum balance. Sometimes you have to pay more than the minimum, because when President Obama was in, he made the credit company put on there exactly, if you pay the minimum balance, how long would it take for you to pay it off? So the planning is how do we begin to formalize exactly this planning so that we get the best out of the planning. And planning is not about just all economics. There's a whole range of things. So you plan on making up your bed during the day? Do you plan on being able to be in the positions where you are getting things done the way it should be done? So so planning is very, very key to your lifestyle and your whole perspective. So, and it's good that you have gained, because you had a good example. All praises to Allah. But we have people that maybe not have that which you may have gotten. So now we have to help them based on the information that you have, in order to give to them the information so that they can grow, so that they can be successful. To be successful is not about, how much money you have, but it's how you plan, because we found people who had a lot of money. And then they used to say, I used to have, not that I have. So these are very, very key points. And I want to kind of conclude, but planning is not about just economics. It's about your whole life. Your whole life has to be planned, and so the young people, when you think about planning, you got to start planning now. You're 10 years old, you're 15, you're 16 years old. You got to start thinking about what is your plan? What is your objective? Where do you want to be? What do you like to do? These are the things. When I was coming up, I thought I was going to be a pilot, or I wanted to be a musician, but it wound up, neither one of them worked out. But at the end of the day, I got a skill. I went to a vocational high school so that I was able to get a skill in terms of dealing, so that I could be able to take care of my life, my lifestyle that I'd like to live. You don't have to live in the neighborhoods that you don't want to live in. You can live in whatever neighborhood you want to live in, but you have to have a plan, and you have to start now. Not when you get 30, 40 years old. You want to start when you're a teenager. Start planning, how to save that money. As you mentioned, putting it away slowly but surely, so that you can reap the benefit of what they call the golden age. So, well, I guess we'll open up for some questions, Eric. And next first Sunday, we're going to have the technology. We have Naeem Najib, who is our co-host as well. He's going to introduce the technical side that the young people like, with the computers and the phones and all of the different technology. He's going to give you some apps that you're going to be able to deal with. So we're going to bring, and hopefully in the month of July, we're going to do an interfaith with regard to business. So, so we want the young people to get engaged. This is not a time for us to be able to just have a communication, of information. We want the information to be filtered so that it can go to work. All right. So, Brother Imam Waris D. Muhammad II, we appreciate. We would like to open up the airwaves so that we can take some questions and then go from there.
Okay, I see a hand up, and if you all are listening, now's the time to ask questions, and the time is very valuable. So make sure that you have your question together before you ask it. We already had we had the program moderated, handled by Brother Eric Shamsuddin and Imam Ishmael Shamsuddin. So we don't need any long speeches. Just make your question direct.
Right.
Inshallah. Okay, I want to say excellent job. You brought the point home when you came in, and what you said complimented Brother Eric in an extremely invaluable way. I too was raised in this community by a family and parents a lot like Brother Eric. And what happened to the example? What happened to the example? My father used to always say that, and you brought memories back of my childhood. My father always say that the example that he gave credit to his upbringing, to the example of the strong believers that he was surrounded with, and that nurtured and carried him, is that his mind was no other way. He never looked outside of his influences, and that's how I was. That's how I was. I was the same kid. I saw beautiful people who set good examples. So we hope to the future that we set good examples for the young people. And thank you. We're on our way, inshallah.
Okay. So as Imam said, there's Brother Ishmael and Brother Eric mentioned about planning. So plan your question before you ask it.
Yeah.
We see a hand in the chat. Those of you in the YouTube audience, please just enter your question in the chat and we'll ask it for you. But those of you on the Zoom side, just raise your hand. Those on the telephone lines, just open up your mic and we'll ask your question there. We'll start with Imam Alfred. Imam Alfred, you go ahead with your question or comment.
Tell him he's muted.
You're muted, Imam Alfred.
I just want to thank you, Brother Imam, and thank you, Brother Eric, for your presentation, and just say progress continues. And we appreciate you and your work. I've been hearing you for well over 50 years. Present before the community, the FY class. You always used to present every Saturday. We would start planning for Savior's Day. And I'm so happy. I would love to see you address us planning for our pre-major events so people can start putting away money for the convention, put away money for Savior's Day. That's what you should emphasize. Yes, sir. Thank you, sir.
Thank you for that suggestion, Imam Alfred. We'll go to the next question or comment for Imam Ismail and Imam Eric. This is the time to ask your question.
Yeah, I have a comment to support my children. Just this morning, I reminded them. I said, today is the first Sunday. Every first Sunday, that we have our program. So I'm gonna need you all's help with, maybe I'll clean the bathrooms. I should give them more responsibility, the kitchen, but they help out a little bit.
Absolutely.
And I told them, I said, look, your rooms, y'all got to get that trash out of your room, make your beds, clean your rooms up, take showers, comb your hair, put some oil in it. We got African-American hair, so we need a little oil.
They have to plan. They have to plan.
I told them,
plan it.
I told them, I said, if you all can manage your bedrooms, I manage the whole house. If you can manage your bedrooms, keep them clean and neat and everything the way it should be, you can manage in the future, you can manage anything. Because that's how I got started. My mother used to tell me, pick the stuff up off the floor and make your bed, clean up your room. And I became
that's really the plan.
Yeah.
That's the plan.
Yeah. And I never stopped planning. We gotta keep planning. That's the key.
Well, speaking of, while we're waiting on people to ask questions, Imam Ismail, Imam Eric, you all, and Imam also, you all mentioned planning. And I know you focus a lot on the youth. You all mentioned focusing on the youth. So this is to all three on the panel. What would you all consider? What does a plan consist of? What does a good plan consist of for the young people that are listening? You say plan your day, plan your future. So what would you consider to be a plan or a good plan? What would it consist of?
I'm not a real expert, but I'm gonna go first because something
go
in
ahead.
my mind. You follow up. Think about what I'm saying.
Okay, go ahead.
Something that I always had in my mind when I wake up in the morning, I have things that I want to accomplish. And it's not things that my mother told me, my father, my job dictated, things that I want to get done that I feel pressed to get done. And I think, man, it's going to take me a couple of days. I'm not going to finish this by 12 or by 1 o'clock because I got to run errands. I got to do. And Allah's my witness. Most of the time, when you just get up and try to start at the beginning of your plan, say, I want to do this, 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 and this in this order, you always finish it in almost, it seems like half or less than half the time. And then I feel so accomplished because I accomplished everything that I planned for that day. And I thought it was going to take 2 days, if it only took one.
Well, I want to, I want to address Imam Adil. I'll just give you an example. When we start off the day, like when I'm getting ready to get up, my day is planned of what I plan on doing for that particular day. That means before I get up and get ready, so when I get to the office, I've already know what I'm going to be doing. I already have an understanding. I've already started planning. So planning starts the minute you get up out of that bed, you have to start. And this for the young people. They have to begin to focus. If they have to go to school, they should know exactly what they're getting ready to, the classes that they're going to attend, how they're going to be able to interact between the teacher and the presentation that she's making or that he's making. So planning is a thought of how you make the progress every day from day to day. So you have to have the thought in mind about, if you don't think about it, you can't accomplish it. So you have to first put it in, and that's what we're trying to do today, is to interject, not so much the interject the idea, and then the idea then becomes a reality because we are starting to infuse into the conversation about the act. And then the actual performance. So that there's another thing about performance and maintenance and a whole bunch of things that we are going to begin. This subject has got a broad perspective, not only just planning, but there's a lot of things that are going with it. So planning for the young people is to start off just with the schooling. They know that they got to plan how they're going to get through the day, and then how they're going to do their homework, and how they're going to be able to play in. I'll give you one example. When we got out of school, we had to, to do certain chores in the house and so forth. Because we wanted to go out to the community center after hours, after we finish everything. So we had to plan our day. So that's what the Imam Warith Muhammad with his children and what they're doing. This is exactly what the individual have to get involved with.
Well, one of the other things that was mentioned that is part of planning is there are a lot of what's called daily routines, things that we do on a daily basis, routines, and there are additional things that may come into play either through shopping or errands or chores, those things. And I think what also goes into planning is the word that you, Imam Ismail, mentioned was accomplishment, goals. See, there are certain goals that we may not be able to achieve on a daily basis. There are some goals that we may be able to achieve today. There may be some goals that may be achieved in a couple of days, as Imam Warith has mentioned. There may be some goals that may not be obtainable, maybe until the end of the month. But planning with as opposed with finances, same thing with financing and savings. some of those goals may be obtained on a daily basis. Listen, if I can save $1 every day, that might be, it may be a small goal, but a goal nonetheless that may be achieved. And then at the end of the day, you will say, well, listen, this is what I have. I've been able to obtain that goal. I plan to save and I've achieved it. And then I will go on to the next day. I'll plan to continue to accomplish my routines. And then afterwards, then these are the goals that I will be able to plan. So I think planning is about goals, routine, and be able to achieve. And sometimes it's okay rather to say, well, I didn't achieve this goal today. I wasn't able to finish the plan that I have. So we'll either be able to fit it in to another time slot or be able to go ahead and do it. So not reaching a goal at this particular time is not a sign of failure. It just means that you have another opportunity to achieve what you set out to plan to do.
Excellent.
Did we answer your?
Yeah, yes, sir. That was excellent. And
okay.
Next. This is an excellent presentation, and it's wisdom. It's great wisdom being shared here. And as Brother Eric mentioned, Imam Eric mentioned earlier about simple things. Sometimes we take the simple things for granted, but this is great wisdom that all three of you have shared. And some of the points that I've taken down and some of the things you all said in common, I'll just read them off from what all of you said in common. It was about first starting, taking action, being focused, accomplishing, achieving, thought, thinking about the thing, progressing, taking action, performing, routine, responsibilities, goals, having a timeline, long-term, short-term, and then taking advantage of the opportunity.
And I was also thinking, and sometimes not having fear of your lack of
experience.
Experience and confidence. With me, it's like I never did this before, so I don't know if I can do it. But most of the time, once you take that first step and you follow through on those steps, you can call somebody to help. We got the internet now. Most projects and things you might start, you could get so much information to help you to make that second step. And then before you know it, you've accomplished something that you couldn't even have imagined doing it before you first took that first step. Take that first step.
We would like to make sure that the young individuals, the students and whatever, for them to participate in this, in the future as we go along, because we're going to keep them engaged as we make our presentation. They will be included in what we are presenting. Is not just for the adults, but this is for them. And then the adults can fit into the process. But this is for the general, but the younger folks, we need their input, because they're our new leaders and our future, and we want to make sure that what we have is that they must have it. They must have it.
Something Eric said that it struck home with me when he mentioned that $50. I'm 56 years old, so I've been working really earning income since I was like 13, summer job.
Okay, so
so I would put $50 away, and that's what struck home with me. And I never stopped until after my wife passed. My finances situation changed, but before then, I think we had a convention or something, and it's a tax issue, but somehow I wound up loaning the Mars Cares. I still want my money back.
Okay, there you go.
But I never get that. I saved $30,000 by only saving $50, which was $100 a month every time I got paid, which I was weekly.
I'll say this much: there's Naeem Najib. I know he used to save. He had a little envelope that he would put money in. In a week. He had an envelope that I saw, because he was with us from the very beginning. So he had a little envelope that he used to put the pennies and dollars in, and so he's good. So I know he's got money. He's got money.
Who this one? Who are you talking about?
Naeem Najib, yeah.
Oh, Najib. Okay.
Well, I would say this, that a lot of these practices are we look at the big time, as I mentioned before, the big time companies, the big time corporations. You know, we may see them on the on the mercantile exchange, or we'll see them on Wall Street. The
Say one
SEC.
thing, I ain't
Yeah.
took my long john off. I ain't bring no
Yeah.
business card now.
And what happens is that you don't have to have use big time corporations, the simple things. And as Imam Warth had said, those things come and you'll be surprised as to the things that you have. What Imam Warth has been doing is still being done by not only myself, but my family members, my children, to this day.
Okay.
Thank you. That looks like all the questions, Imam Ismail and Imam Eric, Imam Warafuddin Muhammad. That's all the questions. So we'll turn it back over to you, Imam Ismail or Imam Eric. If you had any closing remarks for your presentation.
Well, my closing remarks is that, we would like to make sure that we, those who are listening, please get your children, your grandchildren, and all of the young people that you know of to tune in so that they can get the benefit of what we are presenting, so that they can grow and to be able to have the information and knowledge so that they can advance their lives.
And you can do what I did. I don't know if y'all can see this, but I have 5 children. All 5 of them are on there, and they have the same link. I sent the link to the Zoom meeting, so I don't know how many of them got on or if any of them got on, but I took the first step. I sent them the link to the Zoom meeting, so and requested they attend this program, inshallah. And we can do this. Send a copy of the link. It's free.
Yeah, absolutely. So hopefully that if we're all just listening today to get one person, we can double our participation. At the same time, this information can be get, because what Dr. Ramadan did today with the information that they presented, along with what all of the presentation, all of this together, this could be so overwhelming for them.
And what's also good for we think of our community as not having the information that maybe some of these big corporations, a lot of people a lot of speakers are paid big funds, big time monies for the information that that's really that doesn't require a whole lot of thought. And I'm very happy to be a part of this community because we have the information, we have the knowledge, we have the skills right here in our community, and we don't have to go outside to look for these big monolithic corporations to give us the information that we need. So thank you, Brother Imam Warafuddin Muhammad II, and the total staff of the Mosque Cares for allowing us to be a part of this vital presentation. May Allah continue to bless us all.
Thank you so much.
Salam alaikum.
We look forward to seeing you all, inshallah, for June 1st Sunday, inshallah.
Yeah.
So at this time, we're going to turn it over to you, Imam Muhammad.
Yes, I'm gonna be brief. We got a couple of minutes. I wanted to have everything that I had to say. I said most of it throughout the program, but I'm going to greet you all. I'm the president of the Mosque Cares here, and I'm responsible for many of the ministry of Imam W.D. Muhammad vital annual programs. We just finished one, which is one of the biggest that we have, which was the Ramadan session, where we have our leaders, some of the best minds in our community, and some of the best students of our late leader, Imam W.D. Muhammad, the founder of the Mosque Cares, come and do presentations to the community based upon a topic that we came to a mutual choice of it being the best topic to focus upon during that Ramadan session, which is held during the last 10 days. And I just want to mention that it was an overwhelming success. And when we say success, meaning that we couldn't have planned it better ourselves, that we know there was the help of Almighty God, Allah, that guided the speech and the minds of the presenters and us to do the best job that we could do. Yeah, so alhamdulillah, this program, the programs, they're getting better and better, and for no other reason except for to encourage and influence people that we consider being the people that we hope to serve. That's our good future, like the young people, the youth, and the pioneers that sacrificed for so long, and those of us that are still in that middle age, that area, still working hard to raise our children and get them in and through college, and to pay our bills, and to possibly put something away for when we age out of the workforce. That this is who we serve, and this is the purpose of these programs that we have. All praises are due to Allah. This has been an overwhelming success, and as the thought I want to finish that I started out to say is that we cannot take this for granted. Much of what we're doing, I see we're the leaders in this. You know, you don't have to believe it if you don't want to. A lot of us don't believe that Allah gives the leadership and the rule to whom he pleases, and he rotates the command of that amongst people. But today, and I would say since the conception of this small community that we have, because of the intense focus and how we're magnified due to our history as being slaves, sold all in this country and sold all over the world and exploited for our humanity. Now, first of all, the leadership thing is that not always the person on the bottom end of the receiving of the blessings is always the person with the least of the least value. We were taken as slaves because of our value, because of our human value, because what we brought to the table, because of our experience and our expertise and our in nature that God blessed us with, and that he evolved over centuries, thousands, tens and thousands of years of excellent human life. This is why we were chosen to be put through that hardship, and we don't know, only Allah knows. But right now, we're evident that you see the leadership and great quality and great jewels come out of our efforts and our works, and it's being copied, and it's being copied by others, and we should be proud of that. We don't need credit for it. We should be very proud that the world can benefit from the good that you do. For then whatever reason you're doing that good, why are you doing it if it's not to benefit your fellow man? Because God is without want. We're not adding or increasing God's popularity or making him bigger or better. We're making our brother and sister bigger and better. We're increasing their value when we serve them in the best manner. So this is what is most important to us, to act as a community and to continue to give selflessly to humanity. See, we were taken out of humanity. So now's our time and now's our turn to give back, and to give back without asking for any pay for it or anything other than the betterment of the public that we participate in. And I see so many examples. I can't even get started because I never stop talking of the influences that I know, things that came out of my mouth 10, 20 years ago, and things that came out of my father's mouth 50 years ago that I see the world progressing upon and benefiting from. Not to say that I'm a great person, but if you give freely and sincerely, Allah will bless you with the good, and you will give freely and it will benefit others. So this is our plan and this is our hope. So it's 5 o'clock. I'm right on schedule. I wanted to make sure that we're on schedule for our keynote speakers. We have an excellent program. We have Sister Ellen Rockmine, who has been a great asset to the mosque care since and before, since the passing, especially since the passing of Imam Muhammad. She's been responsible for many administrative duties for the mosque cares, and we'd like to invite her on if she's ready to greet us and introduce us to our the keynote speakers for the day, inshallah.
Awesome. Sister Ellen, are you on? We see she.
I'm here. I'm here.
All right.
Assalamu alaikum.
Alaikum assalam.
Let me blur my background.
All right.
Assalamualaikum believers.
Walaikum assalam.
Assalamualaikum Imam Wharfdeen Muhammad and brother Adil, brother Imam Adil, and thank you for the opportunity to allow us to come and present again before the community. I'm sitting on my couch, but I'm going to have to swing back around. Post hospitalization, I deal with swelling. But one of the medications they put me on, my ankles will get like elephants. So just give me a minute. Uh,
Yeah,
but
I would love to comment on your appearance. You look very, very healthy, and I'm happy that I'm seeing you out of the hospital and doing well. And I love that picture of you. My daughter wears her
Alhamdulillah,
hair natural too. Yeah, I'm gonna have to call
Alhamdulillah.
you
Yeah,
sometime. You
yeah,
give us some tips. Yeah, yeah.
Alhamdulillah. Yeah, my hair is natural up under here.
I
That's
told her, I told her
a whole new head
yesterday.
of hair post cancer.
Right. I told her yesterday that most of the sisters we see, if they would take their head wrap off, their hair is natural. Most of them. My mother, she always braided her hair, so I that's something I know. Yeah.
Yeah, look, you get so long and your arms get tired being
Get
up in the
tired.
air. It,
I used to feel bad for Robin because every night I'm like, how you hold your arms up? She in the bed doing this. I don't, you know,
that's tiring.
too
Oh
much
my
work. That's
goodness.
life, though. That's the life of an African American. Yeah.
Yes,
We have the
yes,
most beautiful hair and the best quality. Yeah.
indeed, indeed,
Alhamdulillah.
indeed. But I wanna thank the Muslim Health Consortium. I want to thank Brother Eric Shamsuddin and Brother Ishmael because we're going to follow up with what you guys just presented. Sister Sharon, I always love your presentations, and you just know that I love Imam Ramadan. And I'm having my daughter. They have an organization that they have several agents up under them. So I just gave them the message. I told them between 5 and 5:30. So I'm working to get them on the line. And A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. I want to be able to, I'm not going to give a lot of Quranic scripture because we all know that Allah have told us in the Quran that we have to leave an inheritance. And in so doing, that's the legacy that we will leave for our families. We presented, for those of you who were at the convention last year, we presented briefly last year. But this go round, we're going to be able to become more involved, and we'll be able to show you in detail that in Brother Eric and Brother Ishmael, in the planning and in the compounding and in the growing of income. I was asked to become a licensed life insurance agent while I was undergoing chemo. And while I was studying and preparing to achieve that license for the state of Texas, the resident state first, I became livid. I became so livid that Allah had to calm me down because there is so much information when it comes to financial literacy and wealth strategies that we were not privy to. And the more that I kept going with the acclimating myself to that environment, and the reason that I said that Allah had to calm me down is because I had to work diligently to be able to bring this information to our community because it is so necessary and so needed. Okay. Imam Wharfdeen Muhammad, you talk about $50. Listen to me closely here, grandparents. If you have grandchildren, You can do what's called an index universal life insurance policy that will follow them for the rest of their life until they're 115 years old with $50 a month, and it will compound. And you will leave that grandbaby almost a liquid millionaire. It can be done. That's why Allah calmed me down, because I have temperament. But give me a minute. Give me a minute. I want you to be able to see the strategy. And for those that have retired and have 401ks that they have left at a job, have not retired, but you're 59 and a half without being taxed, that can be transferred over until we're only in the insurance industry. These are the wealth principles that have been used. And this is why we have this massive wealth gap. But this is how this wealth gap can be closed for us. They take those 401ks, 403bs, TSPs is military, IRAs, which is a limit of 6,500 in the society. But here in the insurance industry, a little bit more can be done, and it compounds. Anything happen in the stock market and it takes a dip, over in the insurance industry, it stays level. And then if the index depended upon the growth, it'll grow, it'll compound. Market drop, it'll stay still. But I'm going to allow my daughter, who's an executive in the company, and her husband, I want them to be able to show you the illustrations. So let me mute myself to get them. I don't see Brother Ideal. Do you see Zakia and Bobby Crenshaw?
I'll look for them now.
Okay.
I don't see them as of yet, unless their name is something else on their screen.
Do you see GWG Wealth Group? Generational Wealth Group?
Not yet.
Okay.
Yeah, we have a couple up next. As Sister Ellen mentioned, we'll have the presentation. Are you ready, Sister Ellen?
Yeah, she's hopping on right now. They're hopping on right now because I initially told her 5:30.
Okay. Yes, sir. Yes, ma'am. Not a problem.
Yeah, and we can keep going until they're ready. That we don't have to rush them.
Yes. So
yeah.
I was seeing.
Yeah.
I was seeing Brother Ishmael and Brother Eric's heads nodding. But I really don't want to talk, believers. I really don't. And each of you know that I could talk. I'm tired of talking.
That's
I'm
why we
tired of
picked
talking
you,
in our
sister.
community.
You one of our leaders.
I want our leader said, do not put a limit on the zeros that we want to have on the checks that are coming into our community. Our community needs wealth. Yeah. Period.
Yeah.
No,
I
I'm
always
sorry,
say,
believers. I'm tired of talking.
And wealth is a byproduct of service. All the
Yes.
millions of dollars that the Nation of Islam brought in, back then when the dollar went way further than it goes today. And
Right.
we were still able to accomplish that. You know why? Because we served our community. So you don't
Exactly.
go after money, you go after service.
You
I
go-
tell people that all the
exactly.
time. I don't think they hear me sometimes. I say, if you want money, don't go after money for the sake of money. Go
Go
after
after
service.
service.
Because
Exactly.
if you serve, you the guy that's going to set the price. If you the guy that's providing, you're going to set the price. Somebody's going to say, hey, I don't have the time to do this, brother. Can brother so-and-so, what's brother so-and-so? You know, the mechanic you told me about, or the brother that does the taxes, or this brother. And they say, well, here's his phone number, and he'll be waiting on your call. You see,
Right.
we used to be a community of service. And so
Right.
we put money in. I tell children that. I say, you want some money out of my pocket? Let me come home and the floor is clean, like you just mopped it, and the pillows are fluffed on the couch, and the garbage has been taken out. Man, I might give you too much money. You won't know what
Okay.
to do with it. You know,
Okay.
I might empty my
Okay.
pocket. Yeah,
Okay.
because that means I don't have to break my back all week. You know.
Okay.
Yeah,
Yes.
so money is a byproduct of service. If you want
Yes.
money, you serve, and don't
Yes.
ask for money when you serve. You just serve.
Right.
Somebody's gonna pay you, or guess what? You don't show up the next day. They're gonna wish they had paid you.
Okay. So
Yeah.
it's
And you get a blessing. Let's say they don't pay you. Let's say they don't even say thank you. But guess what? The angels are writing down all our good works and all our good deeds.
exactly.
Yeah.
Exactly.
So you
I'll
get paid
share.
regardless.
I'll share this with everyone until my daughter hops on. When I left my home that night when I was admitted to the hospital, I don't remember leaving my driveway. I don't remember being in the emergency room. Because me and my oldest daughter are nurses. My daughter, the one that's getting ready to come on,
My wife,
she was a drill sergeant in the emergency room. She was dictating what services. That's not my mother right there. Did she have a stroke? Do she have a urinary tract infection? Check her for COVID. She was doing heroic measures. Yeah. And guess what? Because she told them that I was a registered nurse, they complied.
Allah wife.
They complied. And when I snapped awake that Saturday and tried to figure out, okay, what's going on, she had to begin to tell me what transpired. But then she said, Mama, I began to say, is this spiritual warfare? Then I had to explain to her. I said, Allah assigns 2 guardian angels to every individual. You said I began to start speaking in a different language. I said, that was my guardian angels battling for me. She said, I hit a nurse. She said, I had sweet nurses taking care of me. And she explained to them that I was a nurse and that was not my mother's behavior. She said, but one of the nurses, you punched her and she needed to be punched.
Yeah. Yeah.
I was like, oh, okay. May Allah grant those staff the greatest of blessings.
And I'm sure she forgive you because they have enough experience to know that sometimes your spirit can be so powerful that you will act even when your conscious mind isn't all the way there, you know? You know, I've seen people, and people do different things when they are under a lot of stress. They do things and we don't know why, but Allah is in control at all times. So we happy to see that you are a fighter. I'm glad you fight. I wish you hit some more people. I got some people I need you to hit. I'm doing a lot.
Oh my goodness. It is and all I can do is say Alhamdulillah. That I'm forever grateful and that Allah has me here for a purpose and a plan. And I've just expressed that, okay, I'm going to shut up, believers. With no further ado, here we have my daughter.
Thanks for the food. He ate it? Yeah, he said that. He said,
Ignore that. We're working on it. We're gonna clear that.
thank you for cooking.
Okay, this is my daughter, and I told her 5:30, and so
Okay.
she was moving with the
This lady-
quickness.
and she had
Okay,
like a-
so look, forgive me, but they expedited the program here, and I'm all good. And so, with no further ado, Miss Zakia, you can, brother Deal, if you can give her sharing of the screen. Let me do this. Believers, here is my daughter, Zakia Crenshaw, and I'll let her tell you about her history. But this is my daughter that, when you talk about the youth, Brother Ishmael and Brother Eric, this is my daughter that have been an entrepreneur since she was 18 years old. By the time she was 22, she was a six-figure earner. She built a hair salon business for 25 years. They've just been insurance executives in the last 2 years. No, 21, the last 2 years. And they're accelerating up, but they're accelerating up to provide service, especially for our African American community, and they're making headway. And so, with no further ado, I'm going to mute out so that they can provide illustrations so that our community can see where we can go with $50 a month for a children's policy. But if you have 401ks, TSPs, 403bs, IRAs, that can roll over and compound. So thank you so very, very much. Alhamdulillah, and I'm muting out.
All right. Assalamu alaikum, everyone. How are you?
Salam.
Again, my name is Zakia Crenshaw. I am the daughter of Mrs. Sister Ellen Rockman. Like she stated, I've been in this business a little over 2 years, about a year and a half as a broker. It's definitely connected to a prayer. I can't say that this is what I woke up one day and chose to do. I was very passionate about hair, passionate about, helping serve women from the inside out. Because one thing about hair I could tell you is you can do hair just like the magazine that the woman brings in, but if she's not feeling good in her heart, the hairstyle still ain't gonna matter. She's still gonna, not be happy. And so I had to learn very, very young that to put it in God's hands. And that's why eventually my clients named my salon Blessed Hands. And you still see it in Cleveland, Ohio. The signage is still up on East 200th Street. But it was a beautiful business. It allowed me to have a beautiful life, provide a beautiful life for my children, my family. But I always knew that it was something else that God had for me. And as you grow in life, you look at things hindsight and you say, dang, it happened for this cause. It didn't happen to me. It happened for me, for something else that was coming. And so I sit here before you today, and I'm cutting the short story short so I can spend more time on the things you guys want to see. 2017, me and my husband opened a couple of franchise restaurants here in the Dallas-Fort Worth area. We relocated here from Cleveland, Ohio in 2012. In 2017, 5 years later, we opened some restaurants called Burger M. If any of you are familiar with the Burger M, some people call it Burger I Am, but it's Burger M, Hebrew for many burgers. And we selected that. My husband specifically, who wasn't raised in the Islamic tradition, specifically took me to lunch. And I had no idea he was purchasing the restaurant for me. And I got so excited when I got to the menu and saying halal foods. I was like, oh, I know what this is about. We could sell this. You know what I'm saying? I was like, we can do this because I understand the customs. I understand how the food should be prepared. I understand all these things. It's going to be amazing. So the business took off. It did extremely well. A lot of people from the Middle East was our clientele. We had clientele because it was burgers and wings. Everybody likes burgers and wings. But we had a lot of clientele from the Middle East and from Europe because they recognized Burger M like we recognize McDonald's when we go out of the country, right? You recognize the McDonald's arches wherever you go. And so they would specifically ask, as soon as they walk up, is it halal foods? Do you have halal foods or whatever? And you got a separate grill, you got separate grease, different things like that. And so when they realized what my name was, they was like, oh, they would just calm. right? And so we had this restaurant, guys, that did extremely well, and then pandemic happened. And because both of our locations was inside of the mall, they were in public places, and here in Texas, they shut down for 6 months. So we pretty much lost all of our investment. But God always got a ram in the bush. There's always something that God is guiding you to. And one of the young men that we actually used to mentor, because we mentored a lot of people, he actually fell into financial services during pandemic, just kind of by chance. A friend just was calling him, to make sure him and his wife had coverage. And when he found out the level of money that they were making, it made him join the business. And then he took his mental health degree and he partnered it with this certification. And not only is he able to help people with their mental health, he understands that depression, the side effect or the cause of depression in our communities is poverty. And so he was able to take that mental health degree, take this certification, and help inject funding and income into our communities. And so that's what made me get on board. That was my main focus, because during 2020, when we were shut down, I just asked God, hey, if it's not meant for us to have this third restaurant, because we were trying to do brick and mortar, so it wouldn't be no more control from government shutting our restaurants down because it was a public place. If we were brick and mortar, we could do catering, we can do DoorDash, we could do Uber Eats, we could do those types of things because we have more control, where a restaurant wouldn't be shut down. Well, it was so many things happening. I realized it was redlining going on with this business loan. And I just said, God, if it ain't meant for us to open this restaurant, shut it down. And I just asked that the next venture you put us on, help us become the lenders, not the borrowers, and help other people that's connected to us become the lenders and not the borrowers. And I stand here today in front of you as a broker, a year and a half after being in the business. And it's because of servicing so many people and helping them become the bank, helping them cut out the middleman. So those are some things that we're going to kind of talk about. I will do a slight interactive segment. It's how we actually sell. We don't sell products, we educate. By way of educating, people have us as a contact, and they know now who to contact for their needs and services. It's a few things that I wanted to just kind of share with you all. I kind of gauge or vibe off of the whoever I'm sitting in front of. So my assumption is that who I'm sitting in front of right now is the entire Islamic community. And I want you guys to just know a little bit more about who we are, what we do, what we're looking to solve for. So I'm going to go through a brief slideshow really quickly. I won't take too much time presenting because I want to be more interactive. This is just who me and my husband are. Our company is Generational Wealth Group. My husband is a military veteran. We're parents of 3 beautiful boys, a blended family, restaurant owner previous to PHP, and he was an engineer by trade. Myself, as my mother said, 27 years in the beauty industry, owner of several salons, and previous to the brokerage that we're connected to, or the agency we're connected to, PHP, we were restaurant owners. Right now, we're agency owners of PHP. Our mission and vision is to bring back the pride of owning your own business, bring an economy back to our communities, spreading financial literacy within our families and community members to create overlapping, overflowing legacies of generational wealth. We will create millionaires and billionaires by our decision to take responsibility for our finances first, and then by immersing ourselves in a culture of sharing information, mentorship, education, competition, and being around like-minded individuals who know that our ancestors did not sacrifice their lives for us not to take advantage of the possibilities that they lent to us. So that is our mission and vision for our company, and I wanted you guys to understand that. What we do is teach what the wealthy have known. It's not that we're not educated. It's not that some of us haven't had degrees of success. We just not had access. It's been a door, a wall that's been put up that hasn't given us access to what the wealthy people have been doing to get to the next, what the wealthy people have been doing to pass on generational wealth, what the wealthy people have been doing to stay in the same neighborhoods that we're staying in if we're at that level of success, but they still have quality of life. They still have time. Time is our greatest asset, along with health, right? And if you don't have either one of those, you're in trouble. You're in trouble. And so we're just here to fill that void of that information that you guys did not have access to previous to me. Why are people retiring without stability? Back in the day, retirement used to be a 3-legged stool. You had your Social Security that you knew was coming. right? You knew you were going to get that, your pension and your personal savings, right? But what happened if inflation goes up? The companies got rid of pension and you only have Social Security. You don't have a full three-legged stool, so your retirement is unbalanced. So today we'll talk a little bit about annuities so you guys can understand how annuities work in regards to retirement and also building generational wealth. This is a little video that I think is very pertinent. I don't know if anybody on here has experienced this, but I just think it's something that we all have either experienced, know somebody who's experienced it, or ourselves have experienced it. Can you guys hear this video?
Yes. Why don't you own commercial property? We can hear it. It's just a little low.
Okay, let me turn up my volume.
Commercial deal can
Is that better?
For the first time since the 1940s, Americans are reaching retirement in worse financial shape than their parents. An estimated 10 million above the age of 65 are still working. That is a number that has more than doubled since 1985. In tonight's Eye on America report, Mark Strassman introduces us to a man who, like others, may never be able to retire.
Savings, downsize their house and lifestyle, but still have a mortgage they can never pay off. The average American over 65 lives on about $4,100 a month. With
1 second, it's not expanding like it should.
his Walmart checks, their Social Security, and his partial
And Sister Zakia, it may be good to leave it like that and maybe pause it from time to time
Since the
to talk over
1940s,
it.
Americans
We
are
don't get
reaching
a
retirement
right
in worse financial shape than their
Yeah, 'cause
parents.
we're-
An estimated 10 million above the age of 65 are still working.
Can you guys see it? I had to pause it and
Yep.
stop.
Yeah, yes, we
Okay.
can see it. I don't know if you heard what I said
That is
about
a number that has more than doubled
Can you
since
hear me, Sister Zakia?
1985.
No,
Yeah.
I'm sorry. Say that again.
So yeah, you may want to pause it
Pause
in
it,
between
yeah.
instead of playing it straight through.
Like pause it, talk, and then come back to it. Because YouTube, they have a real strict copyright thing where they'll shut us down. And
Right.
yeah, okay.
So is it okay for me to play it? Can y'all see it or no?
Yes, no, yes.
Oh, it looks
we
great,
can see it.
and the sound is good.
Okay.
For the first time since the 1940s, Americans are reaching retirement in worse financial shape than their parents. An estimated 10 million above the age of 65 are still working. That is a number that has more than doubled since 1985. In tonight's Eye on America report, Mark Strassman introduces us to a man who, like others, may never be able to retire.
If I had planned harder when I was younger and if things had went better, I wouldn't be going to work this morning. I'd be going fishing or I'd be going hunting. I'll see you at noon. Or I would have her up going on them trips somewhere. I mean, that's in my mind a lot, and I blame myself for it. We'll just go ahead and punch right in. Morning. Here's your sticker.
Tom Coomer is still working.
Bye-bye.
He's 80 years old, a part-time greeter 5 days a week at Walmart.
Good to see you. Y'all have a great day. Hello.
Mark.
Good to meet you.
We met at this store in Wagner, Oklahoma.
I heard you're basically the mayor of Walmart. Is that true? You know
Well, I'm close to it.
How long have you worked here?
Be going on 9 years.
9 years.
I'm only going to work 30.
Coomer is a kidder, but why he's still working is no joke.
When you got this job,
Zakia, can you hear us?
Yeah, you betcha I did. When you lose your retirement at a big place like McDonnell Douglas, you need a job.
In 1994, McDonnell Douglas closed its plant in nearby Tulsa.
She
Coomer,
can't hear you. She
machinist,
can't hear your
had worked
brother,
there
Adele.
29 years.
And all of a
Yeah,
sudden,
so
the loudspeaker come on, and it said, attention,
Pause it.
McDonnell Douglas will
Commentary
close in
to it,
60
and we
days.
can
And I
play it
mean,
straight
we
through,
stopped
so
and
we don't
looked at
wanna
each other and thought, what in the world?
I'm sorry. Is you saying
Oh,
something?
there we go. Yes, we were saying, so Zakia, if like maybe every 30 seconds or so, you can come in and just give some commentary or pause it. Because the thing is with the copyright, we can't just play it straight through. But you can
Gotcha.
hear-
Okay. Understood. Let me ask this question. How many people on this call have experience, and you can just use the little hand gesture under raised hand, have experience working 20, 30, 40 years for a company and they shut down right before your retirement and you don't get your pension?
Wow.
How many?
Can you ask that one more time, Sister Zakia?
Yes. How many people on this call gave 20, 30, 40 years, 50 years of their life to a company for them to shut down 6 months to a year before your retirement? How many people on the call? You can raise your hand or either put it in the chat. Right?
Yes. She mentioned, please raise your hand or enter in the chat. Also, those in your YouTube audience, if you are in that, have been in that position, please put it in the chat and we'll let Sister Zakia know.
Yeah. If you haven't, do you know somebody who this happened to? Because our goal is being on the proactive end, not the reactive end of what happened to him. Right? But a lot of times we don't know until it's too late. You working and then they just tell you at the end of the day, that's it, you're done. It's shut down. That's what happened to this guy.
Okay, so Zaki, I think I see someone that had they're acknowledging that one of the two situations happened. I don't know which one, but they did acknowledge that that's happened to them.
And that's why he was still working at 80.
That was just like you'd walked up and slapped me in the face.
Because all your plan.
That was just like we stopped and looked at each other and thought, what? Come on. And it said, attention, McDonnell Douglas will close in 60 days. And I mean, we stopped and looked at each other and thought, what in the world? To me, that was just like you'd walked up and slapped me in the face.
Because all your plans.
All my dreams was just then going out the door.
He was 56 years old with an 8th grade education and 1 year shy of a full pension. Financially, the Coomers have never recovered. Over the years, they burned through retirement savings.
So I just wanted you guys to hear the impact of what just happened to him. Because I think sometimes we get comfortable and we get complacent and we forget that we don't have control. You don't have your own business. And even when you have your own business, I've been my own business owner my whole life. I was always solving for what's going to happen when I'm too old to do hair. How am I going to still be able to make $10, $12, $13, $20,000 a month? How can I still do that from behind the chair? Right? And so
Average American over 65 lives at about $4,100 a month. With his Walmart checks, their Social Security, and his partial pension, Tom and Ellen Coomer live at around $3,100 a month, more than $1,000 less than the national average.
Is this the retirement that you imagined?
No.
Tom's wife of 63 years has 4 heart blockages and diabetes. He calls her every break.
I just wanted to check on you and remember I'll be in a little after 11. Never get her out of my mind. Had her too many years, I can't afford to lose her. Have a good day.
Tom Coomer
All righty.
worries he'll never be able to afford retirement.
He likes to work and needs to work, but I feel guilty too because he's having to work at his age.
It hurts me that I can't do for her what I want to do.
Do you feel like the American dream came true for you?
I was right at the door, but I never did get to go through it.
So I just thought that video was impactful. I just kind of ran past it because I talk a lot, guys, to people about retirement, preparing people for retirement, what it's going to look like for them. And I like to work backwards from if you have a pension, let's talk about how much that's going to be. If you know what your last Social Security statement is, let's talk about what that's going to be. But then let's also multiply times 30% because we know it's going to go down. It's not going up. Because it's less of us working, putting in the Social Security pool than it is people drawing from Social Security. So that's why Social Security is set to go down in 2031, right? So how do we prepare for it? So there's multiple ways that we can prepare. You can build something up. You can take a little nest egg of what you have. It's so many different facets and ways that you can actually prepare and help yourself not be in a situation like this young man. where you cornered and you don't have any other way to go, right? And so that's kind of what we're going to be talking about today. I have a few more slides, and then I want to do something more interactive. Most of us, if we're still at working age, we're in what's called the accumulation phase. You're approaching retirement. And then you have to worry about your distribution phase, which is the phase in which you're no longer working and your income is not as high coming in, and you got to make this money last for the rest of your life. Most people don't have something in place, so that money dwindles until it's nothing and all they have is Social Security, right? And so what we're trying to do again is be proactive with making sure that your living expenses is covered if you have a serious medical, unforeseen medical issue. Your regular maintenance is covered, right? If you go get your hair cut, fellas, at the barbershop, ladies, if you go get your hair done, your nails done, a massage, things like that are covered during the entire time you're retired. How do you do that? You do that with something called an annuity. You also have an index universal life policy. But why? 5 reasons why an annuity makes sense is it's guarantees for market losses. So you will never lose in an annuity as long as it's a fixed indexed annuity or a fixed annuity. We as life insurance agents do not have the power to sell you a variable annuity. And a variable annuity is an annuity that still puts your money at market risk. So we only deal with guarantees. What we can guarantee is you'll never lose money. What we can guarantee is income for life. What we can guarantee is tax-deferred growth. What we can guarantee is no contract fees. If you deal with a financial advisor, maybe a Merrill Lynch account, a Goldman Sachs account, they charge 1 to 5%, some monthly, some annually. If you have one of those accounts, I suggest you check to see how much you pay yearly for them to maintain that account, because whether you win or lose, they're still going to get their money. So just be aware of those hidden fees. And then also annuities have long-term care riders on it. How many people on this call have been a caretaker of their parents or a sibling? If you can go ahead and raise your hand. Use the raise hand little icon at the bottom. I know I've been a caretaker, right? I see one, right? Here's the deal. Had our parents known, I know for a fact if my mother would have known, I know for a fact if my grandparents would have known, that there would have been a product, something that they can put money in that would take care of their end of care when they're at their last 5 years or their end stages of life, that they would have made sure they were prepared for that, to keep their dignity as they get older. Dignity is a major deal when people get older. They don't want to have to beg or have to depend on their children or their siblings to take care of them. But because nobody told them, hey, you can get this annuity, what most of our people heard in the community was get this long-term care. And a lot of people didn't get long-term care when jobs offered it because it was so expensive, right? But with an annuity, you could have simply taken your entire 401k, moved it into an annuity. It would have still been tax deferred. You could have set yourself up to get lifetime income from it. And later on in life, it would have been a nest egg built, which I'll show you guys in the illustration, that comes with a wellness care rider that'll cover you in the event that you have a serious medical incident. You need a nurse coming to the house 2 to 3 days a week. You need to be in a skilled nursing facility, or you need to just finish out your time in a retirement home because you got that many medical issues that you got to be sought after, every day. That's what an annuity can do. The other bonus to an annuity is that it's probate free. Probate free simply means in the event that you pass away and you have debtors, your debtors cannot come and intervene your beneficiaries. With an actual life insurance policy, if you have one, salute to you. It needs to be attached to a trust. If it's not attached to a trust, your debtors can still come and hold it in probate court and take the death benefit from your loved ones if you owe debt. So if you still owe a mortgage, if you still owe a car, if you still own student loans, when you pass away, if that life insurance policy is not connected to a trust, it will go to your debtors, not to your beneficiaries. Just wanted to make sure you guys were aware of that. The other bonus to an annuity is, depending on the carrier, you can actually access 5 to 10% every year annually without a penalty. So let's just say you put, for easy numbers, you put $1 million into an annuity. Every year you'll have 100,000 plus access, no harm, no foul, no penalty. You put $100,000 in an annuity, you have access to 10,000 plus every year, no harm, no foul, no penalty. All right. Then as you guys are approaching past retirement, so age 65, past retirement, there's something called RMDs. I need you guys to write that down. R for Romeo, M for Mary, D for David. RMDs mean required minimum distribution. Required minimum distribution. This is a law, it's a federal law that's in place that you're required to take at least a 5% or a 4% distribution of your retirement savings. So what you have in your 401k or your pension, it has to be taxed because this vehicle was always what? Tax deferred. So now at 72, you can have money sitting in this annuity, but you have to draw it if it came from an actual 401k account. If it just came from a bank or from a Roth IRA that's already taxed, you're not forced to have to withdraw, take a distribution just so Uncle Sam can tax it. I want to make sure that I'm clear on what I stated because there's different types of retirement accounts. So you have your 401k, your TSP, your 403b. 403b is people who work for the state. TSP is people who work for the government. 401k and things of that nature is people who work for corporate entities. That's your retirement account. It is tax deferred. If you roll those vehicles over into an annuity, you don't pay fees if it's life insurance, right? No fees involved, no maintenance fees involved, but you do have to take what's called an RMD at age 72. So I just want to make sure you guys are aware of that. So whether you're taking 5% or 10%, it's just so that Uncle Sam can come and get his swipe or no swipe in taxes. But if you take that, say if you had $1 million, if you take that same $1 million and just pull it down off of your 401k account, you're getting hit with 37% taxes. So $370,000 is gone immediately. Which would you rather do? Anybody can unmute. Would you rather give Uncle Sam $370,000 or would you rather roll that money over and then when you turn 72, allow Uncle Sam to take his percentage of the 4 or 5%?
Can the RMD be, I'm sorry, this is by Charlene from Detroit. Can
Yes.
the RMD be taken out on a monthly basis at 3%, 3.5%?
You would
I mean, annual basis, not monthly.
Yeah,
You don't have to take it all,
yeah. I got
you don't
you.
have to take it all out at one time. That's what I'm saying.
No. You don't have to take it all out at one time. That RMD is just a percentage. So you will be, so look at it this way. If you were, so doing quick numbers, and I'll show this to you guys. It'll be easier if I just show you on the whiteboard. Can you guys see my whiteboard? Can you guys see my whiteboard? I want to make sure you guys can see it.
Yes, we can see it.
Okay. All right. So let's talk about this really quick. So let me erase this. Okay. It's going to make a little more sense when I do it this way. So you have 3 ways money grows. You have the bank, you have variable, and then you have indexing, which is life insurance. All right. In the bank, it's fixed. It's not a lot of growth, but we like it because it's safe and it provides liquidity. I know my writing is terrible, y'all. I'm sorry. I'm writing with a mouse, but I hope you guys are following me. Okay. So in a bank, it's protected FDIC up to 250K. Anything over 250K is not protected, guys. Put it in another bank or put it in an index strategy, right? In the bank, most checking and savings accounts, anybody can volunteer. Bashir, since you were already unmuted. In a bank account, if you're just a regular checking or savings account, when you get your statement at the end of the month, do you see any growth?
1 or 2 pennies.
1 or 2 pennies, right? So no growth, right? So the one negative to the bank is really no growth, right? And so let's just say, and it's not even 1%, but let's just say it was 1%. There is something called Rule of 72. You guys can research this and fact check this stuff that I'm telling you. Rule of 72. It simply means that it will take 72 years for your money to double in the bank. So Mr. Bashir, Brother Bashir, would you put your money in the bank to retire?
I would not and have not.
Okay. Okay. But you will put it there so you can have some liquidity, right? Emergency funds, pay your bills, stuff like that.
A little, yes, that's correct.
That's its only purpose. Now, we're going to talk a little bit about variables so that way I can get to your question. In a variable account, this is the 401k that we talked about, TSP, 403b, all of those. Also, what falls in here is stock market and variable and real estate, right? So if I have any real estate, people who own a lot of real estate, you're going to really feel me on this one because I experienced it real tough in 2007, right? So in the variable market, we call it the heart attack line, right? And we call it that because people who've worked for the last 30 years plus, and especially in corporate, if they were putting money into retirement, they've experienced a Y2K dip in income from their 401k accounts, 9/11, right? That was 2001, 2007, 2008, mortgage crisis. That's ugly, but the mortgage crisis. For me, I took a huge dip at this phase in my life because I bought a whole lot of properties, double suiters, single suiters, thinking that I was going to be solving for in my younger years, working years. I was going to be solving for paying off these houses by the age I am today. And these houses would generate income for me for the rest of my life. That was what I was thinking. I was trying to solve for that because I just had a limited viewpoint and I didn't have that blueprint around me of people to tell me exactly what to do with my money. I had my stepdad, Mr. Bashir Workman, telling me make sure I pay myself 10% first before I did anything else. That was the one financial advice I had. Outside of that, I didn't have any more. I was just out on my own trying to figure out what to do with all of this income that I'm making. So I purchased a lot of property. Well, 2008 happened. None of those properties were worth over $30,000. Yet and still, I got $1 million worth of mortgages. Right? So I took a huge spill at 26, 27 years old. Right? But I was young enough to recover. So I don't want to get down. I was young enough to recover, right? But this is the reality of what people have faced. Then you fast forward like 2015, it was a little bit of an oil crisis. And then you fast forward to 2020 was pandemic. And then 2022 was the recession that they didn't name a recession. But this person technically have taken what? 6 hits in their retirement account. 6 hits, but they're told to leave it there because it'll what? Rebound. So let's test that theory then. Right, so I'm going to stop sharing so I can get a clear screen. All right. So, Mr. Bashir, this is no test to see who's smart. That's not what I'm doing here. It's just to get us all to see what we've been programmed to believe. And now that my eyes are wide open and I'm not seeing with rose-colored glasses, I see exactly what's happened to our community and why you see more and more people at Walmart that shouldn't be there, more and more people bagging groceries, more and more people at Costco or picking up jobs after retirement is because they do not have enough money to survive. The cost of living is crazy right now. Gas is up, groceries are up. Now you got to be thinking, let me add up 10, 5, 4, 20, 30, 15. You got to add it up but you get to the register so you ain't embarrassed and your card don't swipe, right? So how do we solve for those issues? These are real issues that people are going through. So if we go back to that variable that we were just discussing, I just wanted a clean slate here. And we've talked about all of the different hits that people have taken, Mr. Bashir. And let's just say this particular person was very savvy with money. I just like to use big numbers, guys. You can take the same numbers and break them down into smaller numbers. I just like to show an impact. And here people like the variable. Would you say that you like 401k at all, Mr. Bashir?
Yes, I do, very much.
Okay. So would you say that you like it because of the growth?
I like it because of the growth and the matching part, correct.
Perfect, the matching. And the matching normally would be, and I don't want you to give your exact numbers, but let's just say the company matched 5%, right? Would that be
that's close.
Okay, perfect. Okay, so this is where, you know, again, it was pensions before. The pensions was a defined benefit contribution. So it was a set vehicle that said you were going to get, you give me 40 years of your life, I'll pay you $4,000 a month for the rest of your life. That was what a pension was, right? They got rid of them in the 70s, brought on 401k, but 401k was never really designed for retirement. It was designed as a tax deferment when taxes are high, when in wartime. Wartime taxes go up because they got to find a way to pay for war, right? So the the 401k plan was a tax deferred vehicle only really designed to help you when taxes was 90%, when taxes was 70%, so that by the time you retired and you put all that money in that nest egg, maybe then when you pull it, taxes will be lower. That was the actual real design of 401k. So now that we've been accustomed to it, because when you get a job in corporate, they say this is a part of your benefit package and we match you 5%. But did you guys know that that 5% that they match, they get to write off as a company? Anybody can respond. Doesn't have to be Bashir. Well, if you didn't know, they get to write off the 5%, but your money that you're putting into the vehicle is being put at risk and you don't get to write it off. You only get to take the loss when it's a loss. I just want y'all to understand that part of the vehicle, right? So it's tax deferred. We know that. No taxes. Your money goes over there without getting hit with taxes. But if you touch it before you 59 and a half, what happens, Mr. Bashir?
You pay taxes and you pay a penalty unless you're buying a new house.
That's right. It's a 10% penalty. It's a tax, taxed on whatever the rate is for that income you pulled. And then when you file your income taxes the next year, you're taxed on it as income. So you get hit 3 times every time you touch that vehicle. You get hit 3 times. And that's the education piece that they're not giving us. So people are using their 401ks as like a bank account where you just go get it when you have some kind of emergency, not realizing how many times you're penalized every time you touch it because you didn't know it was other options. We just didn't know it was other options, right? So let's just say this person got off unscathed at 65 years old with $1 million. And they say, okay, I'm gonna go ahead and draw this money down. It's a 37% tax hit. That means 370 is pulled from it. They're left with 630K. Okay, Mr. Bashir, are you tracking with me still?
Not quite. I have one comment, and your presentation is excellent.
Okay. Go ahead.
I've been dealing with 401ks since I started in the mid 60s, and there are loans that you can get and pay yourself back at 7.5% to 8% without having to touch or get penalized. So I'm not a fair example for the general population.
No, but it's okay. This is a good conversation. So it's only 2 reasons that you can touch it without getting penalized. That's to buy a house and a medical emergency.
Or a loan. Yes, sir. Or a loan. You can do a loan without a penalty. You pay yourself back.
The loan go ahead.
401k loan. Yes, ma'am.
Right. You can take a 401k loan. I'm not denying that you can't, but you get hit with a penalty to touch that loan unless it's for a house or a serious medical emergency. That part you can check. You can check that. I want you to.
I've had at least 6 loans and paid them off without a penalty. It's just a 401k. I've been dealing with 401ks. I retired 10 years ago. And I lived and saved for 10 years, and it's been extremely comfortable because I got a diversified package. Part of what you're saying is absolutely a fact, but there's a broader range to this, and I'm not a financial instructor. I just try to live the life that I planned for when I retired in 2013, and I don't want to work 40 hours a week, and that's where I've been. So it's a long story. It's very diversified, and a lot of experience that goes along with it from my part.
Absolutely. And so thank you for that testimony. You are, again, it's outliers here. You're going to have outliers everywhere you go. But the majority of people, I would say 95% of people who put their money in 401k does not understand the full vehicle and how it works.
You're correct. You are
Right.
correct.
So, and they're not diversified and don't know how to go in and change the indices that it's investing in. They don't know that stuff. That's for somebody that's more advanced, right? But I need to teach the basics so people understand the basics of how the vehicles work and give them an alternative option, which is really just plugging holes in their portfolio. Does that make sense? We'll make sure we tracking and we on the same page. So if this was just a person that doesn't really know, because what I find is people won't touch their 401k when they realize how much taxes they're going to be hit with. They'll let it sit there and risk it getting hit again because they don't want to get hit with 37% taxes, right? So if this was your unique situation, not you individually, if this situation that's on my whiteboard is you, Mr. Bashir, and you took this money out, not knowing that there was another option of where you could put money at, and you took that 630K out, and the average lifespan in the United States of men are 77, but let's just say 80 because good black doesn't crack. And then for women, it's about 88 years old, but let's just say 90 years old for women. If you retired at age 65 years old and you were living to age 80, that's 15 years. If you took this 630K and you divided it by 15 years, you would have to live off of $42,000 a year. Now that's not too bad, but if you somebody who live off of six-figure income or higher, could you survive off of $42,000 a year? I'm asking, anybody can unmute, doesn't have to be Bashir, by the way. Anybody can interact with me on this particular portion of the.
No, sister.
No.
You said no.
No.
Thank you. So now that's for the men. Now let's talk about women because women live longer, right? So with a woman, she's going to live 25 years. So if we take that same 630,000 and we divide it by 25 years, can anybody on this call live off of $25,200 a year?
No.
No. But this is what happens, and this is why you see people working at Walmart, back in Costco, doing side gigs, babysitting kids after they done raised a ton of kids, but they babysitting family kids under the table because they got to be able to make ends meet. So how do we fix that? So what we offer, again, is education and just you guys getting to know other vehicles. So in indexing, this is what wealthy people use. All right. So in indexing, and with wealthy people, shall I say, 60% to 70% of their wealth is in an index vehicle. This is money they cannot afford to lose. The other 30 to 40% is in those vehicles they can afford to lose. So variable vehicles, right? Stock market, right? And then the bank, because we all have to use the bank, right? So variable and bank. We have to use it. We're programmed to pretty much have to use it for liquidity, right? But in indexing, it pretty much looks like this. It's uninterrupted growth. So compounding, compound interest. The floor is 0. So all that simply means is you have a 0% chance of loss. Why is that? The insurance company takes your premium. It goes into corporate bonds. So I'll just put CB there. The corporate bonds grow interest. That interest goes into the stock market. That stock market then goes at a call option. I just put call opt. When the market goes up, they pull what they initially agreed on to pay for that stock. That growth now goes back into the pool with your money. So you never see your money go directly into stock market. That's why the insurance company can guarantee you 0% chance of losses. I just wanted you guys to understand that. Do I need to repeat it or do y'all got it? Okay. Cool beans. Okay. So now with an annuity, This same person who had this $1 million now, because they can roll it over here without getting hit with the tax implication, they're starting at $1 million. Every time that money grows, they get access, 10% of whatever is in there. Even in the first 10 years where it's under surrender charges, right? They get access. When the market takes a dip, they stay right here on the step. They don't go any further than everything that was in there and whatever they've grown. That's how they protect you. And then, as I stated before, lifetime income, long-term care or wellness rider, probate free, right? Access to 5 to 10% income, and you get to grow with the insurance company. This is the best of both worlds, where you get the safety of insurance and you get to grow. Did I kind of clear up what we do with fixed index annuities here and fixed annuities? Anybody have any questions?
Sister Zakia, this is Bashir again. Quick question. What is your annual growth rate on your annuity?
Very good question. That annual growth rate is going to depend on which indices I use. I typically watch the stock market myself to see which ones are the best for the client, but I also allow systematic allocations to allow it to be switched for the client. So if one index I choose isn't performing well that year, the client has the right to go in and change that index. And so your growth can be anywhere from 9% to 20%. It just depends on how well the stock market did that year. And it depends on how much money you're putting in as well. Because if I'm doing a lower amount, you'll notice that it'll have like a cap of 9% or 12% or 14%. But then when I'm doing, or if I'm doing a fixed index, if I'm doing a index that's connected to the stock market where it's more variable, you'll see that rate go from 9%, 21%, 44%, and you'll see 0 where the market maybe didn't do too well. It'll just show 0. So I'm going to show you those illustrations today, actually. I just wanted you guys to have a basis of the different ways money grows so you guys are aware. And then I wanted to show you guys some illustrations so you can kind of see how an annuity actually looks for you guys and run those numbers. So you'll be able to see that shortly, Mr. Bashir. Good question. Any other questions? Okay, cool beans. So I did want to just share with you some of the carriers that we represent. Just really quickly. Some of these carriers are over to the right side of the page. If you guys can see, all are grade A carriers. We represent about 20 carriers right now, soon to be 425. I am looking forward to it, but I am not. I'm in the process of getting my health insurance license as well, so that way I'll be able to offer, Part A, Part B, Part C, those types of things with Medicare, Medicaid. So I'm looking forward to that. But I'm not looking forward to all of the product-specific training that I'm getting ready to have to go through. But for the carriers that you see to the right of my screen right now, can anyone unmute besides for Mr. Bashir? Thank you so much for participating, Mr. Bashir. I'm gonna come back to you when I get to that annuity illustration. Can anybody tell me from where they live to a 5-10 mile radius? Can you walk into any one of these carriers as easy as you could a McDonald's or a Starbucks to get assistance with building out your retirement portfolio, building out a legacy for generational wealth, or obtaining a job?
Don't know.
Well, as easy as the McDonald's or Starbucks, you all know as quick as you leave out of your home, most of us live close to a McDonald's or a Starbucks. So it's likely that most of us do not. And that's where Sister Ellen Rockman comes in as your broker. She's the broker that goes between you guys. She's the distributor for these carriers. And so she can give you access to all of their products and services and all the knowledge that you may need to obtain before moving forward on anything, just for your own knowledge, whether it's with her or with your own life insurance agent. So I just wanted to kind of show you guys some of the carriers that we represent. The products and services that we offer is term insurance, permanent insurance, annuities, and living benefit. And I brought this slide up specifically because I wanted to talk about the living benefit aspect of what we do with life insurance. How many people on this call know anyone who's ever had cancer, stroke, heart attack, or any serious ailment like Alzheimer's, dementia, ALS, multiple sclerosis? Does anybody on this call ever known either themselves or know somebody who's had any of these medical instances?
Several of them.
Right?
Yes.
Well, there's something on policies that's been around because life insurance evolves just like every other technology. It has evolved. So since about 2003, 2004, if you have a life insurance policy that's been in place previous to that, it's likely it does not have an ABR on it. So you may want to write this down. This is my call to action for everybody on the call. Check your life insurance that you have existing in place for an ABR. An ABR is an accelerated benefit rider. Accelerated benefit rider. It is, in other words, it's a living benefit. It allows you to be able to use your life insurance policy, the death benefit portion. We're not talking cash value, guys. I don't want to get it twisted. We're talking strictly the death benefit portion of a life insurance policy. So this is whether it's a term policy, it's a final expense policy, it's a children's whole life policy, or it's a permanent policy. It could be any one of the above. The living benefit rider, it doesn't cost much more than what your premium would normally cost, maybe $3 to $5 more. It gives you access to be able to use the death benefit while you're living, should you have a major medical issue. Now, this is going to protect your household and be a foundation for everything. This will keep you and your family from being displaced should you have a medical incident that's so bad that you can't go back to work. It'll pay you a disability payment every month for the rest of your life, or you can take a lump sum. You take the lump sum, yes, it lapses the policy, but if you got a $500,000 or $1 million term policy and you have a living benefit rider on it, and that garners you 75% of that death benefit, you can pay for your own funeral with $750,000. You can also enact setting your family up for generational wealth. So that's what a living benefit does. Even if it's just a final expense and it's only 40 or 50,000, you can literally get access to help you with the medical bills and stuff that you're dealing with. So it's always more than one way to skin a cat. I just realized that in our community, we're not talking enough about all of the facets that life insurance offers, because it's not just about when you die, it's about when you live. And what's that quality of life while you're living, right? And so I did want to touch on living benefits, because whether you have it or you don't, I want you to make sure that you check what you have to make sure you have it. If you don't, please get with Sister Ellen, so that way she can run some illustrations with free of charge consultations, just to make sure you have what you need. So if you have any health issues that come about, you're covered. If you have existing health issues, say you're diabetic and you're hypertensive, no problem. We got carriers that'll cover you, as long as your A1C is under 10. We can get you covered. As long as your blood pressure ain't running on 250, 200, 220, you can get covered. Long are the days gone where you can't get coverage because you got pre-existing conditions. I have a client that had multiple sclerosis. I got her covered with living benefits. I have military veterans with PTSD and anxiety. I got them covered with living benefits. It's all about how you do things. It is a new way to get people covered, and I'm here to advocate for the community to make sure more of us get access. The greatest way to transfer wealth is through life insurance. If you have not built a massive business to transfer to your kids, and who's to say that you build that business that your kids even want to take on your business? You don't know that, right? So give them access to have a choice to choose what they want to do, right? And so now I'm going to sign in, because I wanted to show you guys really quickly before I hop off, one of the tactics that we use to help build generational wealth. This is a carrier that we offer by the name of Silac. It's just an easier illustration. My preference is Fidelity and Guarantee. I like them because they give you access to 10%, but this is just easier and for time purposes to kind of show you guys some options. So let's say, I'm assuming the majority of the people on the crowd is over, 50 years old. So let's just say you have grandchildren, all right? And you want to ensure that let's say you want to ensure that you leave a legacy for those grandchildren or for your children's children's children, like it says in scripture. Well, the best way to do it is through an annuity. So we're going to go ahead and do Vega. I happen to love Vega. It's just my favorite product. It's several different products, and it's depending on the the client what their scenario is. I'm just using a 3-year-old grandchild. So if somebody on here has a 3-year-old grandchild, this will be perfect for you. But whether it's 3-year-old, 1-year-old, 10-year-old, or 15 or 20, it doesn't matter. The beauty in it is that they get the chance to compound because they're so young. So here, I'm just going to show you, Mr. Bashir, these are the indices here that are of access to me for this particular carrier. So depending on the indice I use is going to depend on the growth. Does that make sense, Mr. Bashir? Because I want to touch on what you asked.
Yes, it does. I'm sorry.
Okay, cool beans. All right, and here I'm going to set it for increasing lifetime withdrawals because I'm structuring this in a way to ensure that for the rest of this child's life, their income that they'll get from this annuity from their parent making a one-time decision to put $10,000 investment in their last name forever. Keyword is one-time $10,000 investment to set up your last name forever. One time. I didn't say multiples of 10,000. I said one time because this carrier, along with Fidelity, the minimum you can start an annuity with is 10,000. So if you started this annuity, I'm going to show you how you're going to be able to solve for generational wealth from this one decision you decide to make. So give it 1 second. It's going to pull up, and I'm going to take me a sip of tea. And thank you all so much for giving me this time today. I don't take it lightly. We're trying to advocate as much as we can in our community to make sure people have access to this knowledge. Can you guys see this? I want to make sure you can see it and it's not too big or too small.
Yes.
Okay, cool beans. So what I like about these illustrations, one is because they actually break down every single definition. So nothing is not transparent for you to be able to see what everything means. But I'm going to just scroll down here and just kind of go over a few things with you. This is the guaranteed portion of this annuity. It's where the insurance company legally has to put in what the guarantee is. So that guarantee just simply means if you put $10,000 in premium one time and never put in another dime, right? And the market crashed today and never came back up. That's why the interest credit rating shows 0. This is what they guarantee you that your account value would never do. You never go under 10,000. That's all that means. Here in the cash value, the reason why it's lower than the 10,000 is because in the first 14 years, because I have this structure for 14 years, there are surrender charges. So if you go in and pull the money right back out, this is what you'll be left with after you pull it out, because you made an agreement with the insurance company to put money in for them to grow it for you, but you reneged and pulled it back out, so they're gonna kind of tap you on the hand. So I just want you guys to understand what you're looking at here, okay? Over here is the wellness withdrawal column. This wellness withdrawal at age, I believe 50, is gonna start having income here. This is how much they'll have access to, and the asterisk just means if there's a medical issue is severe enough, they can get 2 times the amount that's shown. And then the total benefit is just the death benefit that goes to the beneficiary, okay? All right, so I'm going to scroll down past here to the non-guaranteed, or what is based off of the predictions of the market, what the market has done in the past 10 years, and what they're projecting for the next few years, right? And so here, Mr. Bashir, you'll see the first year here is 662, 0 when the market does bad, 4% when it does okay. And then 9%, 9.5% here. So you'll see where it kind of fluctuates up and down. Because you asked the question. If I was putting 100,000, these would be more, but we're just doing 10. Does that make sense, Mr. Bashir?
Yes, yes, it does. Yes, it does. You
want to make sure I'm answering your question at the same time so you can physically see. And now we're going to kind of scroll down here, and let's say this child is 18, getting ready to, go off to college. Well, this account is now 58,709. And you know that because it's connected to the total death benefit, right? That's what's in that actual account. At this point, you can pull out the money needed to help that child go to college. You can pull out the money needed for prom or what have you. But let's fast forward. Let's say the child is out of college. They're doing a little better in life. ready to get married, okay, right? 30 years old, 301,000 is in here in this account. If they decided at that point to pull out all of the money, you could, because as the adult, you're in control of the income. The child is a minor, so the adult is still in control. So in 30 years, that 10,000 has turned into 300,000. And this is just based off of modest growth. It's not like nothing ridiculous, right? Now we're going to scroll down to age 50, because I specifically told you guys at age 50, this is where the wellness care rider comes in, right? But did you guys key in on how much money is in this account? $3,437. But let's just say before then, maybe when a child is 40 years or 37 years old, 40 years later, 40 years old, 37 years later, it's $1 million in this account. Could you not, as the owner or the parent, go into this annuity, pull 10,000 out for every single grandchild that's born at this point? Anybody can unmute, because I want you guys to see how we solve for generational wealth. You can start with one, but that one is going to bring multiples. Because as this money grows, you can go as the owner of it. If you're the grandparent and you did this for your grandchild, you're still the owner. You can turn this over to the child later. They don't have, you know what I mean? However you decide to put this annuity or in a trust for your family, right? However you want to do it. My point in bringing this up is at any point in this annuity, you can go and grab 10,000 and start a new annuity every time another child is born in the family. That's what the Rockefellers did. That's what the Waltons did. That's what the Vanderbilts did. Every year on their birthday, they get a check. Millions of dollars. Wealth ain't going nowhere. This is why they're steady compounding on the money that they're investing in. They will always have money. This is why we've never been able to catch up, because we didn't know this. There's no way you could tell me that your grandparents, your parents, and your great-grandparents, had they known about an annuity, they wouldn't have been investing in annuities a long time ago. We would at this point be first, second, and third generation millionaires had we understood compounding interest. But I'll keep continuing on, because right now we're talking about wellness care. So at this point, if this child needed wellness care for whatever reason, they have enough. We haven't even gotten to distribution yet. I have it set for age 60. At age 60, this account has over 9 million in it. At age 60 and beyond, this child will receive increasing income for the rest of their life because of your one-time choice and decision to put 10,000 down into your family legacy. When this child passes away with modern technology and modern sciences, this child may live to age 100. When this child passes away, they will have 13 million in income that year, and their loved ones will still get 153,351,000 minus however much you borrowed during the duration of that policy. Because whatever you borrow, the death benefit is the collateral for it. In life insurance, you don't have to pay back what you borrow unless you want to make that death benefit whole. As long as the premium is paid, and in this case, you only ever had to pay one premium. But in the life insurance case, if we were talking about an IUL, then in the IUL, you may still be paying premiums for another 5-10 years. So as long as you're paying the premiums, if you borrow during that process of that life insurance policy, you don't have to pay it back. Your death benefit is the collateral for what you borrow. Any questions on what I just showed you guys with this annuity for solving for generational wealth?
I don't have a question, but I do need to contact your agency offline, so I'd like your information.
Awesome. Well, definitely, you guys have access to Sister Ellen Rockman, my mom. She has access to my assistant who books all of my appointments to make sure I'm not overbooking and giving people the time they need. And she'll make sure that we set up any appointments. Again, guys, our consultations is free of charge. We don't charge anything to run numbers for you, just so you can see how we can plug holes in your portfolio. It's not about us making commission. Trust me, we make money. Don't get it twisted. And we're here to make money, but we're here to help. The byproduct of us helping is we get paid to help. Now, I did want to show you guys an IUL, but unfortunately, I'm over my time. And I don't want to bore you all with numbers and putting too much in your face, but I think I put enough in your face to create impact. And I do want to open up for any questions that anybody may have before I, complete today.
Okay, so assalamu alaikum. I have a question.
Yes, ma'am.
Anyway, so I want to apologize for any background noise. But anyway, so okay, so I retired early, and when I retired early, they got me. They just decided, you can't have any money. So, and then they taxed me as well. All right, so I'm taxed every year, and this is on the money that was already taxed. So, my pension was I was already paying taxes on the pension, and then I'm now paying taxes again, for the money that I'm getting. This is the point. This is the question. When do I stop paying taxes on the retirement money? Like, do I turn 65 before I stop, or do I have to always pay taxes on my pension?
On your pension, you're always going to pay taxes on it because it was tax deferred until you start taking distribution. So they're always going to tax that money, unfortunately.
Okay. All right. And so maybe I can get an appointment with you to explain. You can explain to me again what distribution is. Also, the second question I wanted to ask is about how do you, a friend of mine told me that you can get insurance, some type of life insurance, where when you die, it pays off the house. It actually pays off the house. And so the children won't have to deal with going into probate or anything. They could just, like get the house and just pay the taxes. Can you explain that to me?
So we like to call our term policies mortgage insurance policies. When we sit down with the client, we go over your financial house to see how healthy you are, where we can plug those holes in your portfolio. And we most definitely ask the question, what is remaining on your mortgage if you have a mortgage? So that way the policy that we cover you on is big enough to cover that mortgage should something happen to you. That way it gets paid off and your family is not displaced. So that's how we process that. It's just a matter of making sure you have enough coverage to cover that mortgage should something happen to you.
Okay, thank you.
Yes, ma'am. Any other questions for me?
Let me say this right. Assalamu alaikum, believers. Let me say this right quick. My contact information is in the chat. So collect my contact information from the chat and just text me to let me know who you are and when, and I'll check the availability for your situation. Thank you very much. Excellent presentation. Appreciate it very much.
Thank you. And there was one more question and then I'll go.
Yeah, I wanted to ask a question. I'm sorry, I'm sure you probably went over it already. I might have missed it. It's about opening an annuity and how does that work with paying taxes? You pay taxes on that annuity?
Very good question. No, ma'am. So with an annuity, let's just say it's two scenarios. You can either have annuity started where the money is transferred directly out of the bank. That means it's already taxed. So it wouldn't be taxed again. Then you have an annuity where it starts as a rollover from your 401k, TSP, or 403b, whatever your retirement brokerage is. It rolls directly over from there because it was never taxed. That means you're rolling it from a tax deferred vehicle to another tax deferred vehicle, and you will have to pay taxes when you set up your distribution. So depending on that client I sit with, sister, it's either going to be that person wants to let that money sit and grow and they don't want to take any distribution. If that's the case, then you just wouldn't take it until age 72. Because at 72, they're going to force you to anyway because it was a tax deferred vehicle to begin with. So that's where I told you guys to write down the RMDs that was required. Minimum distribution is at age 72. You have to take it. They're going to force you to. If you don't take it, there is a 50% penalty if you don't take your RMD when you're supposed to. So everybody on this call, if you didn't write down nothing else I said, with your retirement vehicle, write down RMD age 72. You have to take it. If you don't, they'll tax you 50%. I'd much rather you put it in a vehicle where if you don't really need the money, because maybe you have other income coming in, you take your 5 or your 10%, let Uncle Sam tax that 5 or 10%. So if you got, for easy numbers, if you had $1 million you rolled over, you took 5% of that $1 million the following year, because you turned 72 the following year. 5% of that million is 50,000. Uncle Sam can only tax you the tax rate for somebody who got income in the $50,000 tax bracket. That's 17 to 22%. Right? So that's how you got to look at your RMDs. Does that make sense? I want to make sure.
I'll be talking to you. I'll be talking.
Yes, ma'am. This stuff can get kind of technical, so I do want it. You know, sometimes it's easier for you guys to write your questions down, and then when we do a consultation with you, just have those questions ready. I would say, you know, have some numbers kind of thrown out ready for us, so I can put an illustration in front of you and we can just break it down, hash it out. I typically will give an hour per appointment, so that way you have time with me to go over any questions you have, even before we start, and then definitely time after. Annuities are a little more detailed conversation, so it normally is a couple of touch points with the client before we proceed forward. All right. Well, it was a pleasure. Thank you so much for allowing me to educate on your platform. We look forward to coming back, because I think sometimes you need to hear it more than one time for it to start to kind of make sense. The next time I will try to have illustrations up and situated for like putting a life insurance policy in place for like your children, grandchildren, and how that builds wealth over time as well. Okay. All right. Thank you so much, Imam. I appreciate it. You guys have a wonderful evening. Bye-bye.
Thank you again. Thank you, Sister Zakia. Again, thank you, Sister Ellen, for the presentation. Inshallah.
Honor and a privilege.
And your information, we do see your information in the chat. So believers, if you do have, you want to connect with Sister Zakia, Sister Ellen will put you in touch with her assistant to schedule the consultations with the program. And did you have any final remarks, Sister Ellen, before we close out regarding the presentation?
No, I just want to again thank the Mosque Cares, Imam Wharfdeen Muhammad II, Brother Adil, and yourself for giving us the opportunity to be able to present to the community so that they could be able to see an illustration as to how things march out, information that was hidden from us. But now that Allah has allowed us to come through the door, the information that we can bring to the community, and that we're not afraid to be able to step into. And I appreciate Brother Bashir Aline for being a participant. But my contact information, Sister Tahida, I couldn't catch the other sister's voice, but my contact information for anyone who wants to be able to have, like I said, it's a free consultation, but we're bringing financial literacy to our community, as to our community being able to see how to put our income to work for us and our families and our communities. You know, that's tremendous. And like I said, I don't want to talk anymore. I just want to just be able to, our faith and that action, to be able to step out on our faith and that action, to be able to have things working in our favor as well.
Yeah, I'm gonna personally make dua for the success of this, because most of us have no idea. We can guess, and we know how few of us can even begin to understand the dynamic, the gravity of how this affects us in our everyday life, how our money actually could be working for us and preparing us. And you know, most of us, you know, die with heavy burdens, debt,
Right,
burden,
exactly.
you know, uncertainty and everything.
Exactly.
And she's opening the door where we could at least start the education process help put us in a position. I always think about things that Imam said. Imam said that a kid that has a doctor that grows up in a household with professionals, one's maybe an engineer, the mom's maybe a let's say a nurse, maybe the dad's a doctor, and somebody else has another degree. So you grow up in a I think he used this, he might have used it when he said that. I think he said a language environment that puts you far ahead of others that are hearing that language for the first time from a professor in college or something. And so what we're doing is we're creating the Mosque Cares and this First Sunday community program. We're creating by having, high caliber guests like this. That sounds like it's a little bit beaten off the beaten path, and it's going to take her to come. She's going to have to come back and talk to us. I know at least a couple more times before.
She said that. She said that.
Okay.
She said that. And think about this. This to being able to share these wealth strategies off the beaten path, if you will, is wealth in and of itself.
Yeah, it is. I agree.
It's wealth in and of itself
because it's going to change us. It's going to cause us to evolve out of that caterpillar into a butterfly. Everybody else is up here flying around here. We still crawling around down here, and that's not where it should be. Yeah,
exactly. You know, when it's turned, those that are familiar with the golf terms, it says it's a long game. But actually, the long game is between these two ears. And that's what it's going to take for us.
Right.
That's why I said,
because this is like foreign to us. We
get
paid, we paycheck to paycheck. That's how most of us.
Exactly.
We get paid, and we thank God if we can pay all our bills.
We're employee mindsets, as opposed to the entrepreneur spirits that was born into us within the Nation of Islam, for those who came through the Nation of Islam, and then up under your father's leadership,
That's right.
Yeah.
So alhamdulillah. That's it's a blessing, and we're extremely proud of her, and we pray for her continued success and to keep moving on. Yeah. Even though I heard her major stumbling blocks, but she didn't stop. She just changed her direction to one that was more pleasing to her, that one that would benefit her more. And because COVID really did a job on us. I heard that half of African Americans businesses actually shut down after the pandemic. And that's horrifying. That's that's apocalyptic. That's like that's like when you look at history and you see a society, a culture that once thrived, and then the scientists are trying to figure out what happened to them.
Exactly.
That's the death of a community.
Exactly.
Lose all this money.
Exactly.
Goodness.
And listen, they were doing very exceptionally well. They were doing. Listen, they were doing with this restaurant to go to this to this restaurant in this extremely busy mall. The food court was on the third level. They were doing exceptionally well, and then COVID come along
and shut it down. Yeah, so we see she's resilient, and I'm sure there's a lot more that we can learn from her. One, from watching her, we can see her intelligence. I'm sure she probably inherited a lot of that from her mom and dad.
But that's what her name. That's what her name means. That's what Zakiya means.
Zakiya means intellect, intelligence. Okay.
Intelligence.
All right.
That's what her name means.
Alhamdulillah. She's very intelligent. And you know what Imam Muhammad said intelligence is?
What's that?
He said that. He said morality is intelligence.
Alhamdulillah.
He said morality is intelligence. So if you got some more, so that goes back to the mom and dad, get that first lesson of what's right and what's wrong, and you stick with it, Allah will take it from there and develop your intellect. Yeah.
Right. You come through the community, she grew up in the community. You understand? You know,
Right.
she got a chance to see
Out
the
there, we hear that.
believers. She got a chance to see the believers in Cleveland. You honored her grandmother, New
Okay.
Orleans Savior's Day, that did over
Oh
60
yeah.
years of charity. That was her
Yeah.
grandmother that you
All right.
honored.
Okay.
That was
Wow.
her grandmother.
Alhamdulillah. And we had a
Okay, and
time. We had a time there in New Orleans. Yeah.
yes, we
Every now and
did,
then I
and
go back and look at that video. We had some fun in New Orleans.
especially when they
Yeah.
came with that second line, and we're
Yeah,
looking
I had
like,
never seen
what?
that like that. I was like, what? They surprised us. Yeah.
Yeah,
Alhamdulillah.
that was exceptionally beautiful.
It
That was
was. I really
exceptionally
enjoyed it.
beautiful. Oh man. So yes,
Inshallah, we go back
alhamdulillah,
someday.
Allah has opened up,
Mhm.
Allah has opened up a door, and we as the believers with our faith,
Mhm.
we just need to come through the door. Because He allowed one to come through. Like I said, Allah
Right.
had to calm
Yeah,
me down
right.
to get them licensed, because I'm listening to this
And see
information.
what happens is she gonna bring a whole lot of more through behind it.
Exactly.
'Cause people gonna see this video,
Because
they're gonna hear her speak.
it's time.
It's time. That's right.
It's time.
Yep. So alhamdulillah. Yeah.
Yes.
And it's just I feel so proud to be a part of this community. Whenever I see somebody that's young and that bright and intellectually and also successful and independent,
Yes.
that's
Yes.
that's like a unicorn in the African American community. They always put the successful ones out front, but what they don't tell you is that she won in a million. They
Right.
don't tell you that.
Right. Right.
And we have her to be proud of. So
Alhamdulillah.
keep up the good work.
Alhamdulillah. Alhamdulillah.
Alhamdulillah.
Yes. So yeah, it's indeed an honor and a privilege,
Mhm.
because I don't know if any of you have ever seen the movie Bicentennial Man. Came out.
Yeah, it was a while ago in the 80s.
It's old.
Okay.
But the one thing that have stuck with me is he, as a robot, would always say, one is always glad to be of service.
Say it one more time.
One is always glad to be of service.
And that's what's from the Bicentennial Man.
Mm-hmm.
Okay. One is
Robin Williams. Robin Williams was the Bicentennial Man.
I remember. Yeah,
Yes.
that was a good movie. I don't remember it, but I do remember its popularity. Yeah, I might go back and check it out.
Yeah.
I have a lot of I'm enjoying my my independence and my freedom because I'm raising my children, and that's my wife. That's exactly what she would have wanted for me to be there and be the parent that she would have been in her absence. And
Alhamdulillah.
I ain't lonesome. I love it. That them kids up there, as long as I know they as long as I know they right there, because I'm heating up food for them now, and I'm about to tell them to come down and eat this food because they have school tomorrow. So,
okay, correct.
But it's a blessing. And
Alhamdulillah.
my whole point was that I've been watching a little more TV. Every now and then I turn a movie on. I might go to Bicentennial Man just to see if I remember it.
Yeah.
Okay.
Yeah.
So, alhamdulillah.
Alhamdulillah. Thank you.
We appreciate you. You take care. Keep taking care of yourself. Watch your health and everything. And because Allah has blessed you, you have a beautiful family, and you got people that love you in your family and in your community. So
Alhamdulillah.
anytime you need us for anything, we right here, phone call away, inshallah.
Alhamdulillah. Alhamdulillah. And I certainly will pick up the phone if need be.
I know we've called on you before. Well, before my wife passed, she was like, I better call Sister Ellen because we didn't know what was going on. She was sick. Remember?
Yeah. I remember. I remember getting that telephone. I remember getting that telephone call, and I'm like, okay, tell Wharf the second to go do this. Okay, tell Wharf the second to go do this. But when I got that other call,
we didn't know. We was just a surprise. We were surprised that
I can't get a call. I can't get a call like that, and I'm not at home because I got to get home. I had to sit in the parking lot.
Right.
I had to sit in the parking lot.
Yeah.
Oh Lord, have mercy. Oh my goodness.
I was messed up.
Yeah, I know you were. I
It was
know you
like,
were.
yeah, I was messed up
We
for
know
about
we know
for
you
a couple of
were.
years. It's like you in a different world for
You
your
are.
mind
You
and everything.
certainly were.
Yep. The only good
You
thing came out of that was I lost like 30 pounds. Because I didn't want to eat, didn't, you know, food didn't taste good. I was sweating and I was always cold. So I had the heat on high. I think I had a space heater in my room. I was always cold. And it was traumatic. It's like PTSD.
yeah,
And
exactly.
yeah,
Exactly.
I cried
Exactly.
for 3 years.
Okay.
Because when it's unexpected like that, for 3 years, whenever the thought would enter my mind, I couldn't hold my tears back. Yeah,
Exactly. Exactly.
because that's the
My
type of person that's not supposed to go all of a sudden. A person
right.
that's conscious about their health and everything, that's taking care of everybody else. She took
Yeah.
care of all of us,
Yeah.
wasn't on
Yeah.
no medication,
Yeah. And
Yeah,
I remember being up there for the October 1st Sunday, and
yeah,
you
right.
needed something, and you all had me security go with her to go to Walmart to pick up
Yeah.
something.
Yeah, because she
And
was sick,
then
but she was sick. We thought it was just pneumonia. But it was when she went to the doctor for the pneumonia, that's when they discovered they said it was just a little spot. But COVID and her taking the antibodies for what we thought was pneumonia, as soon as COVID was discovered, they said the worst thing you could do is take antibodies. So that caused her cancer to rapidly
to
spread. Yeah,
metastasize.
yeah. So it was like the last thing you would expect, but then you think about it, you say, well, she said something to me that helped me, that made my blood run cold. She said, well, the cancer always comes back. And she said it almost like it wasn't herself, almost like somebody else was speaking through her. Like maybe, she was Allah was making her let me know that this ain't no
Preparing
joke.
you,
Preparing.
preparing you, preparing you,
But I was
preparing you.
mentally, I never accepted it. It took me years to accept that. I was mad at her for a minute. I'm like, she could have hung around a little bit longer, but Allah knows best.
Yes, yes,
No.
yeah. But the beauty
Mhm.
is that she didn't suffer.
She didn't.
She
Not
didn't suffer,
Mhm.
and her transition was
Right.
honorable.
It was. It was.
When them
That's the
angels
beauty of it.
came to retrieve her soul, to
Right.
return her soul to Allah,
Mhm.
you were there, so you were gifted that. That was your gift.
It was. It was.
That was your gift.
Right.
My oldest daughter tragically lost her husband. They had only been married 3 years.
Hmm.
And when it transpired, we had just buried my mother.
Hmm.
We had just buried my mother that Saturday.
Mhm.
That Tuesday, she was calling me saying, Mama, there was an accident. He didn't make it.
Wow.
I'm on the phone calling Bashir, screaming and going nuts. And he was like, hold up, what's the matter? He's okay, Ellen. Just hold on, hold on. I'll be there to get you. Just hold on. He was responsible for
Mhm.
dispatch for the city of Cleveland. He
Yeah.
called the call takers up on the floor. He said there was an accident that happened at this time. Who took the call? That was my son-in-law. He
Wow.
found out who took the
That's
call.
Bashir, right?
Yeah, that's Bashir. He
Wow.
found out. He found out who took the call, and he
Mm.
let him know that was his son-in-law.
Okay.
So when that happened, so I understand exactly what
Yeah.
you're saying, because
Right.
she was 35 and he was 42.
Too young.
There
Yeah.
was nothing I could say
You,
to my
you know what?
child.
You know what? When young people pass, when people at their prime like that pass, I think the most valuable thing it kind of taught me by being this close to home, because my brother was young when he passed.
Yeah, I remember
By
that.
being so
And
close.
that's how I met Robin. Me and
Yeah.
Robin walked together when that
Okay.
happened. And I was telling her to extend greetings to greetings to the family.
It taught me how precious life is.
Yes.
Yeah, that's
Yes.
when you lose somebody close to you, It teaches
Yes.
you, especially if you not just a close like a brother and sister, even a brother and sister. Some brothers and sisters are a lot closer than
But
others.
this was your spouse.
That was my
That's the
spouse.
highest level of
So that's why I tell
anxiety
people
that you could be at.
when she passed, so did I.
A part of you did, yes.
A part of me did. It was like a big part of me did.
Mm-hmm. Yeah.
And it's just you can't describe it. It's impossible to describe.
Right.
Yeah.
Right. You know, and may Allah continue to bestow upon you his infinite mercy, peace, and blessing for the journey forward without her physically present with you, but in spirit, she'll always be with you.
Oh yeah, that's what I tell the children. I tell them every now and then, because my son, see, this is what we don't realize. What hurt me more than the fact I lost her is that my babies lost their mother.
Yes.
That was the tough part.
Yes.
This guy, I can
Yes.
take whatever the world gonna give me, I can take it. But I cannot take the pain that my children feel.
Because they don't have the coping mechanisms.
They don't.
They don't have the coping mechanisms.
Oh yeah, so you know, when you remember Robin, remember them and make dua for them. They're doing good because she was a real sound, emotionally and spiritually balanced person. So they appear to be balanced and emotionally and spiritually. But they both hug me every day, sometimes 2 or 3 times a day. And I know that when they hug me back, the way they hug me, they need that hug. They don't have
Yes.
it.
Yes.
I
Right.
just feel that if the value of me just embracing them and not to make them sad, to make them feel good, to let them know
Exactly.
that
It's necessary.
and that
It's
I'm so proud of
necessary.
them and that, they make me happy. I share the joy that they give me back with them. And
Yes.
I think that's the best thing that's going for their recovery from this.
Yes.
Yeah.
Yes.
Yeah,
Yes.
because they ain't gonna never get over the fact they lost their mother.
No, they won't. They
They
won't.
were really
They
close.
won't.
Mm-mm.
They won't.
No.
No, they won't. They won't. That they won't.
That ain't gonna never go away. So I just let my son know, I'm like, dude, you gotta find some, better coping mechanisms instead of getting sad and all of that.
But at his
And if you
age,
want to cry. Yeah.
look, we as the community will have to pray for him to have,
to find peace.
strategic coping mechanisms for him, because he will.
Yeah.
He
was really, really close to his mother.
Yeah.
And you know how sons are. Yeah.
Yeah. Towards that's their first love.
Right.
That's their first love, is their mother.
Yeah. So I try, he's real intelligent, and he's an Aries, and they say Aries have this quality of balance and they real smart, intellectual.
Okay.
And they tough too. So I can't measure how he feels by the way he responds. He don't get mad, but if I say do, he do it. Whatever he need to do, he handles it. He takes care of it.
That's
and,
beautiful.
And you see
That's
him
beautiful.
laughing and joking sometimes, but when he's thinking about his mother and he's feeling sad,
he goes inward.
He goes inward, and you don't see him. So I got to go check on him. When I don't see him, I come and check on him.
Yep. Yeah. Precious.
Yeah. But
precious.
I think he's gonna recover from that to a certain extent, because I've been working with him and letting him know that you have to remember and know that she's always present in you. That pain you feel in your heart, that's your love for her, and that's her presence in your life.
Right, and she wants you to go forward. She wants you to go forward.
Right, and that she's proud of him. I
and
let
she
him know
proud, and she proud of him.
Mm-hmm.
And she'll always be with him, but she wants him to go forward. Yeah.
So it is what it is. And then on top of all the other things teenagers have to deal with.
Woo!
15, he's still the little sweet little boy, but now he in a man body. He almost look at me in the eye. He's big, lifting weights and all the kind of stuff. He's
really.
Oh yeah, Barack is he gonna be taller than me, definitely. I think his hands are bigger than mine already, because he already put his hand up against mine. Yeah.
Okay.
So and I remind him, I said, man, you can't be running through my house like that, tearing up stuff. I said, you ain't little now. But I tease him, but you know how kids are. When they become teenagers, they like to roughhouse and I don't
Yeah.
bother them. I said, remember your sister, she's a woman. She's a woman, and you can't be rough with her. You know.
Right. Right.
Yeah. Even if
Right.
she get rough with you, you got to know how to hold back, you know.
Right. Because
And
she's tiny little thing.
right,
She is
right.
a tiny, she
Yeah,
ain't tiny, she not tiny no more.
she is I think she might be tall as Robin now. I forget her height. Dawa, how tall are you? You 5 what? 5 foot? Okay, she a couple of inches. I think Robin might have been 5'2"? You remember how tall mommy was? She was 8. She don't remember.
Okay.
Yeah, but I think Robin might have been. I think Robin she might add a couple of inches. I think she was 5 foot. But when I look at her, she looks like she's about her mother's height. Yeah.
Okay.
And
Okay.
she grew, so she would really be pleased that both of them are healthy and they growing, and alhamdulillah.
Alhamdulillah.
Our genes look like they're gonna have a good future.
Alhamdulillah. They will. They certainly will.
Yeah,
They certainly will. They certainly will. They certainly will. And like you said, you have the love of community. You have
yeah.
the love and the support of community. And me, I don't know about the others, but me,
I know.
I look at it like this. You have the love of community, but when I look at when our leader, your father, gave you the responsibility of the mosque cares and WDM publications.
Yes, ma'am.
My parents were Southern.
Okay.
I know your dad's parents were Southern.
Yeah, no doubt.
And it's that tradition of Southern is that we have to look out for our brothers and sisters.
Alhamdulillah.
And I know Imam Hamid Rasul is Southern. Okay. In that I look at you as being, he left us, you as a little brother to watch out for you.
Left me, and I feel that 100%, even though born and raised in Chicago, but I was raised by the South.
You was raised by the South.
I was raised by the South. That's what I tell people. That's why I had a nature that I had.
Right.
I was
and
raised by people that gave their heart openly.
Y'all tell y'all I got a temperament. But for those knuckleheads who sat there on stage, you understand, we with the leader, and and they done gleaned all this information and then they walk away.
Where they come from? That's what I'm trying to figure out, because they not of us. They were imposters.
They were imposters. Thank you. Thank you. There's no better word that can be used for that. And they imposters and believers. I have a 7:00 meeting with Zakia, our team. So I'm gonna have to dash. But you all have my.
I could talk to you all night. I appreciate you. And
it's an honor and a privilege. And y'all have my
alhamdulillah.
number. If you need to talk some more, you can give me a call. But she'll lock us out if we let.
Yeah. All right. I'm gonna let you go, because I don't want her to get mad at me. I don't want her to get mad at me.
Yeah. Because mama.
I'm gonna turn it over to Idea.
Let me go to training, okay? Let me go to training and not get locked out.
Follow doctor's orders. Anything you need to do, you got to do. I know your daughter gonna stay on top of you, but that's what I always say.
Lord have mercy. When she told me some of the things she did, I was like,
or eat some food. You gotta do that, because I know you. Yeah, because when you don't have somebody encouraging you all the time, sometimes we forget to eat, we forget to drink, and we forget to rest. Yeah. So you gotta take care of yourself.
I do. But it indeed has been an honor and a privilege to be here before the believers today. And like I said, my number is there. Reach out to me. But my goodness,
I made a good call. I'm glad I asked for you. I hate to feel that I know Ideal probably told you I asked if you could do But
look, my daughter
Oh, yeah.
jacked me up. She was like, "Mama, you told me 5:30."
Yeah.
And I was like, they expedited it. What can I say?
Actually,
She
because he told
flowed,
me,
she
he
flowed
said
and
what
went
you
on
said
through.
between 5 and 5:30. So I told myself I don't want to go the time because I didn't want her to wait. I want her to, not to be waiting. So it
Yeah.
went perfect. The tell her the program was excellent. It went
I
perfect.
will. I will. I will. I will definitely let her know. I will definitely let her know. And I'm looking forward to the believers when you reach out so that we can set appointments so you can get
Right.
before her and she can just map things out and show you where things can go. Because it's a new day. It's a new day and things can be done differently for our community.
Alhamdulillah.
Okay?
All right,
Alhamdulillah.
let's get that wealth.
Okay.
Generate
Yeah,
that wealth.
exactly, man. Warfing Muhammad II. It's time. It's time. Okay.
All right.
All
Sis.
right. Have a good evening, believers. Assalamu alaikum.
Alaikum assalam.
Thank you, Sister Ella.
Honor and a privilege, brother Adil. Honor and a privilege. Assalamu alaikum. Love you all.
Love you back. Alhamdulillah.
Thank you, Sister Ellen. Again, our believers will be closing out here. Thank you all for joining us. Again, in the chat, you can please donate to the Mosque Cares. You can go to themosquecares.com to donate, as well as you can go into the chat and click on the link to donate as well. And if you want to donate at any time to the Mosque Cares via Zelle, you can just enter the Mosque Cares email address as the recipient, which is wdmministry@sbcglobal.net. And you can donate through your banking institution via Zelle. And again, that's wdmministry@sbcglobal.net. And again, thank you all for joining us. We look forward to you joining us for next month, the June 1st Sunday, inshallah, which will be June 2nd. June 2nd will be the next First Sunday community program. And we look forward to you joining us for that. So at this time, I'll turn it over to the imam to make any final remarks, and then we'll conclude our program.
Yeah, okay. Yeah. We appreciate you all that attend these Mosque Cares First Sunday programs, that without your participation and without your support, that these programs would never reach the potential that we have seen so far. So we thank you, and we pray that Allah showers you with his choice, blessings, and success and mercy from the Almighty God, Allah. And so we want to say good night to everybody, and hope everybody has a good week in the this week coming. We know it's Sunday. A lot of people have responsibilities to the household and community. And I'm going to turn it over now. We're going to close out with a dua. I'm going to turn it over to Imam Elam. He's going to close us out with a dua. And we look forward to seeing you all back here on June 2nd for the First Sunday community meeting. Thank you.
Yes. Thank you, Imam Muhammad and Imam Adil for excellent First Sunday program. Excellent lineup. Excellent job. Thank you.
Alhamdulillah.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Ar-Rahmanir-Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal ladina an'amta alayhim. Ghayril maghdubi alayhim waladdallin. Ameen.
Ameen.